dapat po munang alamin or matukoy ang pangunahing problema ng bansa upang mapagtuunan ng pansin at mabigyan ng solusyon.
We should have specific goals, do research, and make a policy that is fair for everyone.
Walang problema sa pulisiya. Iayos lang ang pagpapatupad.
Bago patubas ang batas, pag-aralan muna gusto ng government.
Two things, clarity and execution. Both, you need the communication and monitoring. As simple as that.
Mandato ng Philippine Institute for Development Studies o PIDS na gumawa ng mga pag-aaral at pananaliksik ng mga polisiya at programa ng pamahalaan at magbigay ng rekomendasyon sa mga mambabatas sa pagbabalangkas ng mga polisiyang makakatulong sa ating bansa. Sinusulong ng aming ahensya ang evidence-based policy making upang bigyan diin ng kahalagahan ng polisiya na batay sa datos at policy research na sumusuri sa tunay na kalagayan ng ating mga komunidad. Napakahalaga ng policy research, lalo na sa mga panahong dumadaan sa krisis ang ating bansa.
Kapag pulisiya ay pinag-aralan, susulong ang bayan.
In need of references for your research? Do you want a digital library that you can access for free anytime and anywhere? You don't have to look far. SERPI is here for you. SERPI is an online database of socioeconomic materials produced by the Philippine Institute for Development Studies, government agencies, research and academic institutions, and international organizations based in the Philippines. It is the country's first online repository of socioeconomic information, created for policymakers and development practitioners, researchers, educators, and students. To access SERPI, just visit the PIDS website and click the SERPI widget under the Databases tab, or type serp-p.pids.gov.ph. SERPI has a wide variety of materials such as journal articles, books, research papers, working papers, policy notes, audiovisual materials, and more. As of 2022, SERPI has more than 60 partner institutions contributing knowledge resources to the database. SERPI provides a comprehensive coverage of references encompassing 22 research themes: labor and education, gender and development, poverty, technology and innovation, trade and industry, and many more. On the enhanced website of SERPI, you can filter your research by keyword or author, publication type, research theme, or year published, all at the same time. SERPI has more than 7,000 publications and audiovisual materials that you can access and download for free. What are you waiting for? Visit SERPI now. Socioeconomic research portal for the Philippines, innovating knowledge exchange and policy research.
So what is PIDS? For over 40 years, the Philippine Institute for Development Studies, or PIDS, has been the country's foremost socio-economic think tank. It conducts rigorous and objective policy research and analyses that help the government in crafting relevant policies, plans, and programs in support of the country's long-term vision and development goals. PIDS pursues its mandate through three basic programs: research, dissemination, and outreach. Through its research program, PIDS identifies and prioritizes studies, develops proposals, and conducts research on priority areas. The results of these studies are then disseminated through different platforms, publications, online resources, PIDS Corner, seminars, and the Development Policy Research Month, or DPRM, held every September. To shed light on key policy issues, the advice and expertise of the Institute's research fellows are also sought by policymakers, government agencies, private sector, and civil society. Since 1977, PIDS has completed numerous policy studies on a wide range of development topics. This brand of service has then translated to policies and programs that have improved the lives of every Filipino. Philippine Institute for Development Studies, service through policy research.
Dapat po munang alamin or matukoy ang pangunahing problema ng bansa upang mapagtuunan ng pansin at mabigyan ng solusyon.
We should have specific goals, do research, and make a policy that is fair for everyone.
Walang problema sa pulisiya. Iayos lang ang pagpapatupad.
Bago patubas ang batas, pag-aralan muna gusto ng government.
Two things, clarity and execution. Both, you need the communication and monitoring. As simple as that.
Mandato ng Philippine Institute for Development Studies o PIDS na gumawa ng mga pag-aaral at pananaliksik ng mga polisiya at programa ng pamahalaan at magbigay ng rekomendasyon sa mga mambabatas sa pagbabalangkas ng mga polisiyang makakatulong sa ating bansa. Sinusulong ng aming ahensya ang evidence-based policy making upang bigyan diin ang kahalagahan ng polisiya na batay sa datos at policy research na sumusuri sa tunay na kalagayan ng ating mga komunidad. Napakahalaga ng policy research, lalo na sa mga panahong dumadaan sa krisis ang ating bansa.
Kapag pulisiya ay pinag-aralan, susulong ang bayan.
In need of references for your research? Do you want a digital library that you can access for free anytime and anywhere? You don't have to look far. SERPI is here for you. SERPI is an online database of socioeconomic materials produced by the Philippine Institute for Development Studies, government agencies, research and academic institutions, and international organizations based in the Philippines. It is the country's first online repository of socioeconomic information, created for policymakers and development practitioners, researchers, educators, and students. To access SERPI, just visit the PIDS website and click the SERPI widget under the Databases tab, or type serp-p.pids.gov.ph. SERPI has a wide variety of materials such as journal articles, books, research papers, working papers, policy notes, audiovisual materials, and more. As of 2022, SERPI has more than 60 partner institutions contributing knowledge resources to the database. SERPI provides a comprehensive coverage of references encompassing 22 research themes: labor and education, gender and development, poverty, technology and innovation, trade and industry, and many more. On the enhanced website of SERPI, you can filter your research by keyword or author, publication type, research theme, or year published, all at the same time. SERPI has more than 7,000 publications and audiovisual materials that you can access and download for free. What are you waiting for? Visit SERPI now. Socioeconomic research portal for the Philippines, innovating knowledge exchange and policy research.
So what is PIDS? For over 40 years, the Philippine Institute for Development Studies, or PIDS, has been the country's foremost socioeconomic think tank. It conducts rigorous and objective policy research and analyses that help the government in crafting relevant policies, plans, and programs in support of the country's long-term vision and development goals. PIDS pursues its mandate through three basic programs: research, dissemination, and outreach. Through its research program, PIDS identifies and prioritizes studies, develops proposals, and conducts research on priority areas. The results of these studies are then disseminated through different platforms, publications, online resources, PIDS Corner, seminars, and the Development Policy Research Month, or DPRM, held every September. To shed light on key policy issues, the advice and expertise of the Institute's research fellows are also sought by policymakers, government agencies, private sector, and civil society. Since 1977, PIDS has completed numerous policy studies on a wide range of development topics. This brand of service has then translated to policies and programs that have improved the lives of every Filipino. Philippine Institute for Development Studies, service through policy research.
Good afternoon, everyone. Welcome to the PIDS webinar series, a platform where we feature our policy studies and the insights of our researchers and our development partners in government, academe, private sector, and civil society to promote informed public discourse of development issues. I'm Sheila Siar, your host and moderator. Kahapon, June 7, pinagdiwang natin ang National Migrant Workers Day. It was a one-day observance which undoubtedly was not enough to recognize the hard work and contribution of our overseas Filipino workers or OFWs. We are therefore extending the celebration today by devoting this afternoon's webinar to revisit the Philippines' response to the plight of our OFWs at the height of the COVID-19 pandemic, to extract lessons that can help us improve our support programs for our migrant workers. We will also look at the state of health and social security systems in the Philippines and in East Asia. where many of our migrant workers are located, how accessible these systems are to them, as well as their literacy of these health and social security systems. By doing so, we hope to identify the gaps that need to be filled and explore strategies to better serve the needs of our OFWs. To start our conversation, let's listen to the welcome message of Dr. Aniceto Orbeta Jr., the president of PIDS. Team, please. Okay, so we are waiting for the recorded message, please.
Good afternoon and welcome to our public webinar on protecting our own, investigating OFW's COVID-19 challenges and health and social security systems literacy. Before we begin, I would like to acknowledge the presence of the following: National Economic and Development Authority Assistant Secretary Greg Pineda, Department of Foreign Affairs Deputy Assistant Secretary for Migrant Worker Affairs Bernadette Mendoza, League of Municipalities of the Philippine Secretary General Mayor Attorney Cynthia Pacotelo Cortez, Kadlungan Center Foundation Board of Trustee Members Rose Bayan, University of Asia and the Pacific Director Juvi Dakanay, International Migration Organization for Migration National Project Officer Ellene Lorenzo. Let me also greet our guests, officials, and colleagues from the government, academia, civil society, media, and the private sector, and those watching through the PIDS and SERPI Facebook pages. In celebration of June 7 as a Migrant Workers' Day, we dedicate today's webinar to our overseas Filipino workers, or OFWs, our modern-day heroes. Based on the results of the Overseas Filipino Workers Survey conducted by the Philippine Statistics Authority, or PSA, it was found that from April to September 2019, there were 2.2 million OFWs, with contract workers comprising 96.8% of the total. However, a year later, following the outbreak of the COVID-19 pandemic, the number of OFWs decreased by 18.6%, resulting in approximately 406,000 OFWs losing their jobs and over 400,000 households experiencing economic insecurity. The impact of COVID-19 on our OFWs had significant effect on remittances, which have long played a crucial role in supporting the household income, consumption, and investment in the Philippines. The total remittances sent from April to September 2019, amounting to 211.9 billion, declined to 134.7 billion in the subsequent year. In the same period, the average remittance sent by each OFW dropped from approximately 107,000 to almost 87,000 in 2020, before gradually increasing to 91,000 pesos in 2021. When families or households rely heavily on OFWs for their survival, it raises the concerns about what actions our migrant workers can take with their health, livelihood, and overall security are threatened. Who can they seek assistance from, and where can they find support for their needs and safety while in a foreign country? Considering that the PSA data indicated that only 1/3 of OFWs had savings in the year preceding the pandemic, what safeguards do we have in place for their welfare? COVID-19 pandemic has demonstrated how it overwhelmed governments, healthcare systems, industries, and citizens globally. Although the status of COVID-19 as a global health emergency have subsided, new risks have emerged, such as the ongoing Russia-Ukraine war and the internal conflict in Sudan. These developments put the lives of our OFWs at risk and cast uncertainty on their future. Today, we feature two studies that tackle issues on confronting the welfare of our OFWs. First, our back-to-back presentation is the PIDS study, COVID-19 and the Philippine migrant workers, looking into the Philippine government's post-COVID-19 support mechanisms by PIDS Senior Research Fellow Aubrey Tabuga, and research analyst Ana Rita Vargas and Madeline Luis Bainio. The paper investigated the support programs for the repatriation and return of OFWs in the wake of the pandemic. Dr. Tabuga, our presenter for this paper, will share their findings and recommendations to help government and stakeholders respond to future events of similar nature and magnitude. This afternoon's virtual forum also features the study scooping study on health and social security systems literacy of Filipino migrant workers in East Asia by PIDS consultant Jocelyn, Celero, Melissa Carabeles, and Evangeline Katigbak-Montoya. Here, the authors examine this health and social security systems literacy of OFWs in East Asia. We will hear from Dr. Celero and Dr. Katigbak-Montoya about their research and policy recommendations for strengthened collaboration between Philippine government, academics, migrant workers, and the Filipino migrant workers to increase the literacy of our migrant workers on health and social security systems. To enrich the conversation, we also have responses and insights from our esteemed guests. We have Director Jocelyn Hapal of the Overseas Workers and Welfare Administration, or OWA, and Executive Director Ellene Sana of Center for Migrant Advocacy. We are thankful to have both of you joining us in this webinar. To our attendees, please stay until the end of the webinar. I encourage you to actively participate in the open forum. To our OFWs who are watching now, we sincerely thank you for everything you have done for your family and our country. Thank you. I now give back the floor to the moderator.
Thank you very much, Dr. Orbeta, for this message, for setting the tone of this afternoon's discussion. Dr. Orbeta cannot join us live today as he needs to attend a meeting of the Second Congressional Commission on Education, or EDCOM2, where PIDS serves as the Commission's research arm. Okay, so before I introduce our first presenter, just some quick reminders on how to join the discussion. So you may post your questions and comments using the Q&A button. Please indicate your name and organization if you want to be called or you want to be identified when I read the questions. And to all the speakers, you may respond by typing your answers, which will be visible to all the attendees. And alternatively, you can choose to answer the questions live during the open forum. And for our live stream viewers on Facebook, we highly encourage you to participate as well. Please use the comment section on Facebook for your questions, and we will accommodate as many questions as possible that are relevant to the discussion during the open forum. So, friends, let us now listen to the first presentation. And this is, as mentioned by Dr. Orbeta, it's based on the PIDS study, the COVID-19 and Filipino migrant workers, looking into the Philippine government's post-COVID-19 support mechanism. This is available on the PIDS website. You can download the full text. And this study was authored by Dr. Aubrey Tabuga, Ms. Ana Rita Vargas, and Ms. Madeline Bainio. Okay, and the presentation will be given by Dr. Tabuga, Senior Research Fellow at PIDS, whose research interests include social protection, poverty reduction, and systems thinking in governance. She has published on international migration, social networks, and evidence-based policy making. Dr. Tabuga obtained her PhD in public policy from the Lee Kuan Yew School of Public Policy, National University of Singapore. Dr. Tabuga, Aubrey, the floor is now yours.
Thank you, Dr. Shar, for that kind introduction. Before I go to my presentation, let me start the discussion with a poll question, just to get our viewers to warm up to our topic today. So the poll question is being shown on the screen, and to respond, kindly go to the link shown in the chat box. So the question is, what comes to your mind when you hear the phrase migrant workers? So you have 10 seconds to send in your inputs. I think you can provide maximum of 3 words. And there are no right or wrong answers here. So we just want to know your thoughts. So I think 10 seconds will be just about now. Okay. So the largest word in the word cloud is OFW, and the others are hard work and there's also remittance, sacrifice. I think this is the responses are coming in, so babago yung. So the largest words are now FW and remittance. I think that's very interesting, and I think so sacrifice is also showing up as one of the key terms. So thank you very much for those inputs, for your active participation. It shows how Filipinos really view, and I myself, I think when I hear the word migrant workers, I would think first about sacrifice. Okay, so let me now go to the presentation. I'd like to first acknowledge my co-authors, Ms. Rita Vargas and Ms. Madeline Baini, for their excellent assistance in terms of producing this paper and in doing the analysis. So our study is really about documenting the Philippines government's COVID-19 support mechanism. So sorry, I'd just like to correct the term that we use. It should be COVID-19, not post-COVID-19, because a lot of the assistance, the support were provided during really the pandemic. So please note that when we say support mechanism, we have given the aspect of repatriation a greater emphasis rather than the implementation, for instance, of reintegration programs, which I think merits a separate study. And we did this, we chose this focus because I felt that the task of repatriation was so great during those times, and I think this warrants a documentation, especially the lessons that we have learned from it. So next slide, please. Okay, so let me just, this is the outline of the study. So basically the discussion will revolve around the background being just the overview of impacts of the COVID-19 to our migrant workers and also overseas Filipinos. And then I'll go very quickly lang on the COVID-19 support system. And I mean when I say support system, it's actually the policy framework that supports the operations, the processes that we did. And then I'll move and focus more on the discussion about the crisis management, meaning the processes of repatriation, and then the strategies of communication, and then we look at the various lessons that we have learned. And so from these, I try to synthesize by looking at the lessons that we've learned from the pandemic. Next slide, please. Next slide. Okay, so what are the impacts of the pandemic to overseas Filipinos? Well, we can categorize them using these categories. So, well, the economic impact, we've seen that, and there were massive job losses, there were income reductions or lower pay because of how the COVID-19 affected many businesses around the world. And OFWs have exhausted their savings. Of course, COVID-19 is a health emergency, was a health emergency of incomparable scale. So what are the direct impacts? These are deaths, sickness, isolation. We saw reports of stress and anxiety and also mental issues. And then, of course, there were also challenges associated with the processes of relief, repatriation, return, and reintegration. And we will look into this, we will discuss this in more details later on. Next slide, please. For us to get a better view of how big the numbers were in terms of the arrivals, which the government and its partners had to manage during the time. These are the data of the OFW returnees. So, hindi pa kasama dito yung non-OFW. So, as of end of August 2022, when we were doing this study, 2.3 million OFWs returned. And that comprises of the land-based workers and the sea-based workers. If you look at the end of 2020, when things were intense, it was around 600,000 of them, plus 129,000 non-OFWs. On the right panel, you can right panel of the slide, we can see how the remittances went on a dive during the early part of 2020, although we can see how fast it recovered. And I think it is now at levels that is comparable to the pre-pandemic period. Although I think the deployment has not gone back to pre-pandemic period still. Next slide, please. Okay, so the government has also implemented a massive Balik Probinsya program. The Balik Probinsya is the program that helped or facilitated the return of overseas Filipinos to their residences. So as of end of August 2022, over 1 million returning overseas Filipinos benefited from the Balik Probinsya program. 50% of them traveled by air, 40% by land, and 9% by sea. If you look at the monthly data, at the bottom left na graph, we can see how a large portion of these were assisted in 2020 and in 2021, and the numbers became smaller as we opened up our economy in 2022. So mas konti na sila. In terms of the confirmed cases of COVID-19 infection, as of end August 2022, there were 33,500 returning overseas Filipinos who contracted the disease with 99.7% recovery rate. In terms of deaths among returning overseas Filipinos, during the same period, that is end of August 2022, 7,577 returning overseas Filipinos have died from the pandemic. Next slide, please. So what do we know about the returnees? So in terms of origin of returnees, the DFA repatriation data showed, although this is in 2020, it shows that an overwhelming majority came from the Middle East, which is the top destination of our workers. And I think that's an expected outcome. Now, we also looked into a study that was conducted by IOM sometime in 2020, and that study showed that not all of the returnees came home due to the virus. So, but majority, or 67%, came home due to the pandemic. And we can see here that a bulk of them, or the majority of them, are relatively young. That's their age between 25 to 39. And that an overwhelming proportion, 83%, remain unemployed 3 months post-arrival. Next slide, please. So given these effects, what we wanted to do in our study was really to document and examine the support mechanisms implemented in the Philippines. And in the paper, we identified interventions or support provided by the government to our overseas Filipino workers. And we focused also on the key processes and mechanisms of operation and coordination among various entities from the government and also non-government bodies, because they also played quite a significant role. And what we really wanted also is to really discuss the challenges or extract the challenges so that we can draw lessons from them. So in the end of this presentation, what we really want to come up with are the lessons that we need to learn from this pandemic. Next slide, please. So just to show you briefly our conceptual framework, we are using one that comes from the literature of crisis management through the leadership lens, and so we are looking at these dimensions. I think this was useful for us to know which aspects to use in terms of this analysis. And we did not have information for all the stages that you can see here in terms of the, say, preparedness, early recognition, and sense making critical decisions, looking at coordination. But we just we just obtained those that where we can get information in terms of these categories. So in terms of data sources naman, we use mainly administrative data from various sources, and we also did some key informant interviews with our partners in the government, those who were frontline workers during the pandemic. Next slide, please. Okay, so I'll go through the policy framework very fast because this has lots of information, but I just have, I think, 10 minutes to discuss the rest of the presentation. So, but basically what we want to show here is that prior to the pandemic, the Philippines policy framework that governs its responses to crisis situation has been informed by our experience in the past, and I think it's important because this indicates quite a lot of learning in the labor migration governance aspects. Next slide, please. So, for instance, following the Gulf War, where we had to repatriate 30,000 Filipinos from Kuwait during that time, the government came up with these policies afterwards. So, for instance, the assistance to national task force, the country team approach. We also came up with our with RA 8042, which is the key policy for protection of our migrant workers, and then we also came up with the crisis management and security manual for overseas Filipinos. Next slide, please. Following the Israel-Lebanon conflict, where we also had to repatriate thousands of Filipinos, we had our RA 10022, which is the amendment amending the RA 8042, and then following the Arab Spring, we came up with these policies, including, for instance, the Joint Manual of Operations, and then the IMRA, the Interagency Medical Repatriation Assistance Program for overseas Filipinos. Next slide, please. We have also clearly identified our plans, how to go about it in terms of preparation, the repatriation during the crisis, and then post-repatriation. We've also clearly identified the teams and also their roles. Next slide, please. And we have clear mechanisms in place in the event of a crisis, as shown by this country team approach and its elements. Next slide, please. Of course, you may be familiar already with the different OFW programs meant for assisting affected migrant workers. We have social benefits, we have educational training, of course, repatriation is there, and we also have reintegration programs. Next slide, please. So the policies that have been mentioned, they have been set, prior to the pandemic, which help a lot in the preparation of the country in addressing the effects of the pandemic on the overseas Filipino workers. Now let's move to the processes in addressing the effects of the pandemic. So in response to the events in early 2020, the following directives, advisories have been promulgated, and this is the timeline of those directives. So we have here the voluntary repatriation from China in the early days of the COVID-19 pandemic. We are also familiar with the declaration of the state of public health emergency, and we also have quite a lot of directives here from DOLE, from POEA, from TFA, and even from the Office of the President. Next slide, please. In terms of how the quarantine operations were implemented or the repatriation processes, this graph came from the OWA, and it's very useful in showing the different stages, from airport assistance to quarantine monitoring and accommodation, and lastly to transportation going to to the OFWs and overseas Filipinos residences. Next slide, please. Okay, so the graph that was shown earlier was quite simple, but if we zoom in, it's actually like this. So it's more complicated. You can see there are 9 steps here, from health check to mandatory quarantine briefing to booking of a quarantine facility, then checkups, also, and then transportation. So there were quite a lot of steps. Next slide, please. That one is for land-based, and the next slide will show the process for seafarers. This one, and I think this is the one-stop shop for arriving seafarers going to I think Visayas and Mindanao. So you can also see here. You can see the steps, and you can see the agency responsible for these different aspects or steps. Next slide, please. So just to sort of validate the processes that have been published in our government agencies websites. So we also talked to OFWs who returned, and true enough, these are it's quite the same as the flowchart that was shown earlier. It's just that there are also interesting items here, like for instance, there were group chats when they are put in quarantine accommodation. They have group chats that make communication easier, and the health checks, they happen quite a lot of health checks here. You have health checks dun sa number 2, and then health checks sa 8 when they arrive at their facility ground, and then there are also swab tests when they're already in the quarantine hotel. Of course, this may differ depending on the schedule of their arrivals, because we had different protocols at different times during that time. Next slide, please. I just want to show also the returning overseas Filipinos by points of entry. So we can see here that 3/4 came in via the NAIA terminals, our main points of entry. And I think it's useful for us to have this and to inform, for instance, our policies and our programs, wherein it's important that other points of entry be capacitated in the future, so that we wouldn't be the main points of entry would be too overcrowded, and then this overcrowding can lead to other problems as well. Next slide, please. I'd also like to show you that most of the testing were done by trained personnel of the Philippine Coast Guards in our airports, although there are also other partners who did some of the tests. Next slide, please. Just to show you, this is the 6-day swabbing operation, and again, it's the PCG that did most of the testing. Next slide, please. So there were different swabbing operations. So my 6-day, my 7-day. Again, this depends on the protocols that we've had, and they were changing during that time. Next slide, please. In here, we show you the programs that have been implemented to assist OFWs on site in repatriation and in recovery, and also in their return to their provinces, and also in terms of reintegration. Next slide, please. And then this table shows the beneficiaries. So what we can see here is that while there are many OFWs who have returned, there are very negligible numbers that benefited from the other programs. So yung pinaka-popular is the Dole AKAP the Abot Kamay ang Pagtulong program, the one-time financial assistance. And I think it's important to also look to analyze what have been the challenges associated with participation in the other programs. Because if you see here, although this one is end of 2021 yung latest kasi. So I think it's important that we also look into whether there are constraints in participating kasi medyo mababa yung uptake ng other programs. Next slide, please. Okay, so in terms of financial resources utilized for COVID-19 response, the DOLE and the OWA have incurred a total of 19 billion. But we are checking the timeline of this because based on the 2020 data for the OWA alone, based on their annual report, the OWA spent 13.3 billion for 2020 fiscal year. So it would be important for us to get the entirety of the financial resources that have been utilized, and that helps us in our future sort of policy formulation of programs, and para like ganito pala kadami o kalaki yung kailangan mo if ever we are in the same situation in the future, sana din naman. So yeah, I think we need to improve or update this particular data. Next slide, please. Now we move to communication. This is one of the aspects wherein we got some information. What we did here is that we came up with our typology for purposes of analysis. So we looked at intragovernmental coordination. We also looked at communication, government to people communication, and then people to government communication, and government to other organizations. So for intra-governmental coordination, these are the strategies that were implemented. We have the one country approach for on-site coordination. And then we also have regular communication between on-site and home offices. And there is also a multi-agency initiative for a task force has been formed. I think this is under the broader umbrella of the IATF. Next slide, please. And those were frameworks for communication. In terms of government to people, the strategies cited were the use of technology in closing information gaps. I think there's a best practice here, which is the OFW Assistance Information System, or WASIS at DOLE. And it was crucial in managing the various processes of repatriation, testing, quarantine, and transport. Information dissemination is also done using online websites and social media for the government to communicate to the people, the constituents. Next slide, please. In terms of this is a continuation of government to people. So communication is also done through house parents, as I've mentioned earlier, in quarantine facilities. So since the protocols change quite frequently, so there was a need for close communication to disseminate the changes in terms of the protocol. So in quarantine facilities, they have what they call house parents. These are representatives of OWA, and they are the ones managing the affairs of the OFWs in the quarantine facilities. There is also this online forum called Uwi and Na, and they were useful in terms of communicating to the people. I think the role of the recruitment agencies also was important. Of course, social media. Next slide, please. In terms of people to government communication, again, the strategies were the use of social media. The OFWs would communicate to the government, like in the embassies, using emails, WhatsApp, and their Facebook pages. Next slide, please. Okay, so for government to other organizations, communication strategies, there were data sharing and coordination with host countries, and also the coordination with the recruitment agencies proved to be crucial. So yun yung parang isa dun sa naging important contribution, yung close coordination between the government agencies in the host countries and the recruitment agencies as well, and the organizations of migrant workers. So that's also a notable, those are notable strategies for communication. Next slide, please. Okay, so in terms of challenges, in our study, we also looked into the challenges in emergency repatriation that is not health related. And the purpose here was really to collect all the challenges that can hamper smooth repatriation process. So because I think we might be able to use this information in the future. So based on the past repatriations that we've had, we got this from the literature, the problems, the challenges there that we experienced were the lack of data on the profile of OFWs, and this hampered the organization of OFW repatriation. For instance, numbers were mere aggregates, so there were lack of information in terms of location and gender distribution. The presence also of unauthorized or undocumented migrants, especially women, in domestic work, also contributed to the slow and costly repatriation in the past. And also, if we look at the Middle East, where the mobility of women is restricted, I think that was also one of the factors that hampered repatriation processes. There were positive factors. The employers from the formal sectors, they helped to facilitate the repatriation. For instance, in the past, like in Libya, but employers of domestic workers for instance, in Syria before were less supportive. So yeah, these are the challenges in non health related emergency repatriation. Now we move to the COVID-19 related challenges. Next slide, please. So there was slow process of repatriation, and I think this is this is due to various factors. Not I think this is it come from the literature. So these are documented challenges, these factors include airport closures, absence of flights, restrictions to flight entry, the uncertainty about who will shoulder the cost of repatriation was also a factor, and of course the closures of embassies due to infected personnel. So some of these are really beyond the control of like our authorities. So yeah, so there was a slow process of repatriation, and then of course inadequate government funds. This was reported in the news. I think the FA experienced depleting funds at some point. Also OWA also reported shortage of funds. And then post-arrival challenges include, delays in testing and release of medical clearance, the quarantine facilities being overcrowded. There were also delays in arrival, and the delays in arrival led to the extended stays of seafarers in dock ships. Of course, there was stress and anxiety, as mentioned earlier. We also heard about stigmatized returnees and poor lodging conditions. So next slide, please. So we also looked into how these challenges have been interrelated, because we wanted to know how best to address them, possibly in the future. So you can see, I really love this kind of sort of concept mapping. Whenever I do a study, I try to look at interconnections. So the study also featured that. Next slide, please. In terms of communication, these are also the challenges that we have noted. Next slide, please. We have fragmented response. I think next slide, please. Next slide. Next slide, please. Yeah, so in terms of communication, we have noted fragmented response, and this I think owes to the multi-sectoral nature of the OFW, the needs of the OFWs. And I think earlier during the at the onset of the pandemic, there were problems in terms of data privacy and our structures hindering the provision of the timely provision of assistance. There was also lack of awareness on how to access assistance at first. I can only understand the confusion because of there's so many things going on. And the pandemic also impacted our government operations because, face-to-face assistance, there were times it was limited. And then, of course, agency-to-agency coordination was also hampered due to, of course, some of the personnels have been infected also. And one of the challenges that have been noted in terms of the use of digital dissemination of information is that not all OFWs are internet proficient, and so they did not have access to the information because they were not proficient in using digital platforms. And also there were issues concerning fake news and disinformation. Now the lessons learned. Let me just go very quickly on this one. Next slide, please. Okay, so in the literature, some of the good practices that have been mentioned included the utilization of recruitment and manning agencies in the process. I think they played important role in the repatriation of our workers. So I think this aspect is something that can further enhance, so we can engage them more actively. And also the use of online and social media. This was noted as a best practice from our experience. Next slide, please. As mentioned, the use of technology was instrumental in the process, and hopefully this will continue, to be developed and enhanced for us to better cater to the needs of migrant workers, not only in times of crisis, but also in their day-to-day life as migrant workers. And also the partnerships that have been built due to the mammoth task of repatriation during the pandemic era. I mean, the networks among the host countries, the Philippine government agencies, and the migrant organizations. These are some of the things that must be nurtured, for various purposes. For instance, in terms of facilitating, for example, a referral system that can help address the needs of OFWs. Next slide, please. So this is the last slide. Okay, so lastly, if we excel in deploying workers overseas, which is often mentioned in various texts, that we have this best model for facilitating labor migration. We have to be a good model as well for repatriation of our workers. And we learn from our experience that repatriation is not just a simple assistance of bringing people back to the country, but a system that relies on numerous interrelated factors. For instance, we needed adequate facilities for testing or medical care. The other important factors were the availability, having available and unhampered flights and entry into the country, functional embassies and or consulates, adequate accommodation or temporary shelters. Shelters are very popular today because of the recent happenings. Also, the importance of social protection. There are scholars who have been saying that perhaps it's helpful to explore an insurance scheme for OFWs that cushions them in case of mandatory repatriation or unprepared return to the country. And also, we had to have effective communication and feedback platform, the one-stop shop for information dissemination and help desk with tracking. I think this is important. The OASIs being something like that, and if we improve on that, I think that will be a more powerful platform for migrant workers in terms of communication and feedback. Of course, the cooperation of the migrant workers and their employers was also very instrumental, and I think it's important that we really educate them. efficient system for logistics was also very crucial, and also the importance of coordination of government with migrant organizations and workers affiliation to groups that support migrants that are based on site were also important. We also do not discard, by the way, I wasn't able to discuss here, but we do not discard the importance of the broader policy operations framework that was put in place by the previous administration, so that the IATF and its subunits were truly a manifestation of the whole of government approach, and also the quick response of the legislative branch of the government, and the crucial role of the LGUs, and also government's partnership with the private sector and other organizations, civil society groups. It really brought this whole of society approach in addressing the effects of the pandemic. Before, as a scholar, I've been also thinking about ano ba talaga how do we operationalize what we call a whole of nation or whole of society. You just need to look at how the IITF worked and all its subunits, and you will understand. So lastly, we hope we won't have this, we won't have another crisis like the COVID-19. But I think if we will again face a similar situation, God forbid, I think that we will be more capable to face it if we learn from all the lessons that we had from our pandemic experience, and if we enhance all our mechanisms and processes. That's the end. Thank you for your attention.
And thank you very much, Dr. Tabuga, for that thought-provoking, very insightful presentation. Indeed, the pandemic, the COVID-19 pandemic, was a very tough time for our overseas Filipino workers, and we really should take stock of the lessons that we can learn from this pandemic. We can learn from the response, our response, the government's response, and thank you for emphasizing the need for a whole of society, whole of nation approach in addressing the impacts of the pandemic. We will hear more from Dr. Au during the open forum, and if you have questions regarding her presentation or regarding the full study, then please just type your question on the Q&A box. I already saw some interesting questions, and we will address those questions. Dr. Au will be more than pleased to answer them during the open forum. But for now, I invite you to listen to the second presentation, which is titled Scoping Study on Health and Social Security Systems Literacy of Filipino Migrant Workers in East Asia. And this was authored by Dr. Jocelyn Celero, Dr. Melissa Garabiles, and Dr. Evangeline Katigbak-Montoya. And this study was supported by the Philippine Apex Study Center Network, or PASCN, which is led by PIDS. To present the study's findings and recommendations are Dr. Celero and Montoya. Dr. Jocelyn Celero is an associate professor at the Asian Center University of the Philippines, Diliman. She obtained her PhD in International Studies in 2016 and completed her Japan Student Services Organization follow-up research fellowship at Waseda University in Japan. Since 2019, she has served as research consultant at UPCFAL Philippines, a training, advocacy, and research center that focuses on the interwoven themes of migration, gender equality, and the 2030 Agenda for Sustainable Development. Dr. Celero has published on migration and the transnationality of Filipino migrants and Japanese Filipinos. Meanwhile, Dr. Evangeline Katigbak-Montoya is an assistant professor and the Southeast Asia Program Coordinator at the Department of International Studies at De La Salle University. She obtained her PhD in Geography from the National University of Singapore and was a postdoctoral fellow at the Nanyang Technological University National Institute of Education. Her research interests include transnational migration, emotional geographies, and development studies. Her research works have been on transnational families, translocal moral economies, and geographies of hope and aspirations. Dr. Celero and Montoya, you now have the virtual floor.
Thank you very much, Dr. Shar, for your generous introduction. It's an honor to be here, finally, as one of the presenters and no longer a part of the virtual audience. Thank you very much, PIDS. Before I dive into our presentation, I would like to invite our dear audience to answer the poll question being flashed on the screen. We have here, yes, this question, which of these services does your family or household have? So does your family have PhilHealth, Pag-ibig, SSS? And you may tick all of those three if the income earners in your family are enrolled in all three.
So Dr. Montoya, Dr. Celero, by services, we are looking at health and social security systems.
Right, in the Philippines. So notably,
okay.
PhilHealth, CHIS or SSS, and Pag-ibig. So as you can see here, the results show, okay, so more or less our attendees this afternoon have their are enrolled in PhilHealth, GSIS, or SSS, at least one of the members of their household. There's less than two. Okay, still changing. Okay, so they're relatively less in number of enrollees for Pag-ibig. Thank you very much to our attendees this afternoon for your input. So at least you can see here, more or less, you have an idea of how familiar, whether our attendees this afternoon are registered to these programs or related to healthcare and social security system in the Philippines. Thank you very much. At least that already sets the tone of our presentation. On behalf of my colleagues, Dr. Melissa Garabiles, also my colleague this afternoon is joining me in presenting this research, Dr. Evangeline Katigbak-Montoya, I'd like to once again thank PIDS for funding this study last year and for giving us this opportunity to present this research today to the greater public. Our study is, I'm happy to inform everyone that it's now on its second wave, where we are developing tools to evaluate the level of knowledge of OFWs of the existing healthcare and social protection in Hong Kong, Singapore, and Japan, as well as the Philippines, the country of origin. We hope to collaborate with concerned Philippine agencies, government agencies, as well as NGOs, and Filipino migrant workers in the process of data collection. So next slide, please. This afternoon's presentation is divided into 4 parts. I am in charge of giving an overview of our research, as well as a background of Filipino migrants, Filipino labor migration to East Asia, while my colleague, Dr. Montoya, will describe the methodology and present the findings of our scoping review, as well as the inputs from the focus group discussions we conducted with OFWs in the 3 destination countries. I will share inputs from the Philippine government, the interviews we conducted with Philippine government agencies, SSS, PhilHealth, Pag-ibig, Insurance Commission, the DOH. We also interviewed them, and I head on to the concluding section before Dr. Montoya gives the recommendations for policy making. Next slide, please. So our project aims to review the current corpus of knowledge on the prevailing health and social security systems in Japan, Hong Kong, and Singapore, as well as the Philippines. We also survey the state of systems literacy of Filipino migrant workers. When we say health and social security systems literacy, we mean the level of familiarity with, understanding, and knowledge of Filipino migrant workers about the healthcare and social services in the Philippines, as well as sending countries. The level of literacy of OFWs may vary depending on several factors, their period of residence in the host country, their language ability, their access to various portals of information and support, and accumulated experiences navigating those systems over time. Next slide, please. Our study has 3 research questions. So we aim to shed light on the following. First, what is known about the health and social security systems in migrant receiving countries such as Singapore, Hong Kong, and Japan? and migrant sending countries such as the Philippines. Number two, to what extent do sending countries such as the Philippines and receiving countries ensure that migrant workers are informed about and access health and social security systems? And thirdly, are Filipino migrant workers based in East Asia health and social security systems literate? Next slide, please. So the Philippines, let me describe the Philippines as a sending country. It's been a migrant labor sending country for the last 5 decades or so. In 2022 alone, majority of 1.77 million OFWs are currently based in the many countries across Asia. And more than half of them are female, taking on elementary occupations, most notably domestic work. Next slide, please. East Asia is a major destination region, perhaps next to Middle East or West Asia, for Filipino migrant workers from the 1960s. In the 1970s, in Japan in particular, the country started accepting marriage migrants and entertainers, those working in the red light districts. While the expat-populated island of Hong Kong and highly industrialized city-state of Singapore began taking domestic workers from the 1980s, a little later than Japan. These destinations have a high level of economic growth, which enables them to offer high wages, relatively higher wages than other countries in the region. And because they are geographically close to the Philippines, it's very strategic and practical for thousands of OFWs to seek employment in these countries. As of 2022, according to the Philippine Statistics Authority, there are 62,000 OFWs who entered Japan, 111,602 came to Hong Kong, while 93,887 are based in Singapore. These are significantly lower figures due to, of course, delayed or canceled job contracts and border closures during the pandemic. Next slide, please. As of 2021, Filipinos make up the fourth largest group of migrants in Japan with 282,798, or almost 10% of the total number of foreign workers employed in the country. Migrant workers are generally categorized into two: status-based and activity-based. Status-based workers include permanent residents, spouse, and child of a Japanese national visa holder, as well as long-term resident visa holders who can work unrestrictedly in Japan. Activity-based workers, meanwhile, refer to highly skilled professionals, technical interns, designated activity visa holders, and that includes domestic workers recruited for Japanese as well as expat households, EPA or Economic Partnership Agreement nurses and caregivers, as well as asylum seekers. There are also students and those engaged in, overall, these are the group of migrant workers who engage in work but with restrictions. Next slide, please. Meanwhile, in Hong Kong, Filipinos make up the second largest migrant population. Majority of them are situated in the domestic sector, with 163,500, or 89% of the total OFWs employed in the island. Next slide. In Singapore, well, Singapore is one of the top 10 destination countries for OFWs. In this city-state, a total number of 162,223 Filipino workers reside in this island who are subjected to the work pass system, which is the main policy instrument used by the Singaporean government to control the foreign labor. It generally classifies foreign workers into either professionals and skilled or semi-skilled workers. I turn you over to Dr. Montoya. Next
All
slide,
right,
please.
good afternoon, everyone. I will be talking about our research methods, particularly the scoping review, and thereafter the focus group discussions we conducted with OFWs in Japan, Hong Kong, and Singapore. This scoping study surveyed the existing literature on the health and social security literacy of Filipino migrants in East Asia. The study used Confidence, a web-based software used to screen, extract, and analyze references for scoping review. Qualitative data, which complemented and substantiated the scoping review, was derived from FGD and semi-structured interviews with representatives of Philippine agencies mandated to look after the health and welfare of OFWs. For the PRISMA results, next slide please, there were 60 studies extracted and analyzed in the scoping study. 25 were focused in Japan, 16 in Hong Kong, and only 8 looked at the case of Singapore, including 3 which focused on ASEAN. The remaining 11 were about the health and social security systems in the Philippines for OFWs. Next slide. Here are the findings from the scoping review. First, on the state of health and social security systems in East Asia. Migrant workers experience health and social inequities in destination countries relative to citizens. The following are the enablers. So enablers and barriers. Enablers of health and social security include number 1, laws and international conventions that mandate workers' basic rights, protection. Number 2, formal channels of resources. 3, informal channels. And 4th, government's openness to migrant activism. Barriers were also identified in the literature, which include precarity of work, limitations in service capacity of the governments of the Philippines and the receiving countries, in this case, Hong Kong, Japan, and Singapore. There were financial barriers, language and cultural barriers, and disinformation. Next slide. Second, in regards to the state of health and social security system of the Philippines, OFWs rely on and are connected to the systems based only on their membership contributions. And these are the enablers. 1, laws. 2, variety of provisions. And 3, bilateral agreements. So for the scoping review research gaps that we identified through the study. Next slide. First, so these are the gaps in knowledge. The concept of migrant health and social security literacy exists in some of the studies reviewed, but an accurate definition does not. There were only related words and phrases like knowledge, understanding, but not literacy. Second, most studies on migrant workers' health and social security systems focus more on accessibility rather than literacy. Lastly, studies that include Filipino migrants need to consider factors such as gender, visa status, occupation, and period of stay in destination country, as well as the intersectionality of these factors in explaining migrant literacy. I will now proceed to the discussion of the findings from the online FGP we conducted with female OFWs in Japan, Hong Kong, and Singapore between July and September 2022. Next slide. FGDs in Japan participants included 10 expat-sponsored domestic workers and 5 recruited through Philippine recruitment agencies and were outsourced by their housekeeping service company counterparts in Japan. The FGD with OFWs in Hong Kong included 6 participants, all of whom were domestic workers. They have been working in in Hong Kong for at least 8 years. The FGD with 5 Singapore-based OFWs included 2 domestic workers, 2 e-pass holders or professionals before they became permanent residents, while the other one holds an S-pass or semi-skilled visa. For Japan, the FGD findings in Japan, next slide. FGD data indicated that OFWs have some knowledge of the health and social security systems abroad. In Japan, all participants were familiar with the national health insurance. They also had their MY number, and they also were aware of the employment insurance and national pension systems. Participants likewise noticed widespread improvements in the Japanese healthcare system over time that helped them navigate language differences. So there were English-speaking staff in Japanese offices. Furthermore, during the pandemic, a stimulus allowance from the Japanese government was given in 2020 to all residents, including migrants who have been living in Japan for at least 3 months. Most of them received vaccinations, while a few who contracted the virus received free hospitalization, paid sick leaves, hotel quarantines, food and medicine rations. Some migrants receive a $200 financial assistance from OWA through the Philippine Embassy. They learn about the support from the Filipino peers who likewise have received this allowance and were actively involved in the activities of the embassy. Next slide. So FGD findings for Hong Kong and Singapore. In Hong Kong, OFW participants shared being entitled to 2-year health insurance, which keeps checkup costs and medicine at affordable prices. During the pandemic, participants said they experienced being assisted by the Hong Kong government to keep them safe and well. They received free COVID-19 home test kits and RT-PCR. They also knew OFWs who stayed in isolation facilities when they tested positive. Singapore-based OFW said that they have mandated health insurance and health screenings, which were easy to access. They also receive assistance from Singapore government for COVID testing and vaccination. When the Philippine government, they only had knowledge about OWA assistance for homebound OFWs from their friends who went home during the height of the pandemic. Next slide. FGD data showed similarities with scoping review findings on enablers of health and social security systems literacy. Formal channels included the Philippine and foreign governments, healthcare workers, churches, NGOs, and migrant workers organizations. Formal channels boosted access to health and social security. For example, medical subsidies can be availed through PhilHealth. Informal channels were likewise mentioned, especially families, friends, employers, and the media. Informal channels paved the way for greater literacy. For instance, OFW families reminded them to pay for their membership. Informal channels also helped OFWs access the systems better. OFWs' friends, for example, were instrumental in navigating the systems by interpreting for them information materials that are in foreign languages. Next slide. In terms of barriers to access, similar to scoping review results, OFWs mentioned precarity in terms of dependence on their employers to navigate the systems. Problems with Philippine government were identified as a barrier. While the Philippine consulate was acknowledged as an important source of support, negative experiences in transacting with the consulates or embassies lower familiarity and trust in the Philippine system. So there were instances that participants said, natarayan sila or sungitan sila. Moreover, during the pandemic, they disapproved of the exclusion of OFW families from financial assistance from the Philippine government, while some were entitled to receive monetary support in case they got infected with COVID-19. The paperwork they had to submit was too complicated and time-consuming, and the money arrived months later. Next slide. The last slide for this section of our presentation. Other barriers include financial challenges due to high placement fees and increase in expenses at home. So for example, there were higher tuition fees, and cultural differences, notably the language as a barrier, especially when they were still new abroad. Additionally, personal barriers to literacy were included. Others acknowledged, for example, that OFWs lacked time and they were too tired to learn about health and social security. So I pass on the time to Dr. Celero for the interviews with Philippine agencies.
Thank you. So next slide, please. Yes, so based on the interviews we conducted with the 6 selected Philippine government agencies, we found out that an enabling factor of the Philippine health and social security systems is the existence of an office or a division that directly caters to the health and social welfare of our OFWs. Migrant Health Unit of DOH as a Migrant Health Unit. The International Affairs Department is the OFW arm of OSSS. Pag-ibig has an International Operations Department or OFW Center. So in a way, the institutionalization of health and social security for OFWs really helps our government agencies to assist our OFWs. These agencies are united in envisioning envisioning a more portable health and social security systems for our OFWs in the near future. However, there are barriers to realizing this vision, and this includes the absence of bilateral agreement. So in fact, out of the 3 destination countries, only Japan has a social security agreement with the Philippines, which was signed in 2015, and it is not yet on full swing as of this year. Number two is limited health and social security infrastructure that can support globally dispersed OFWs. So our infrastructure of healthcare and social protection is very limited. Three, the basic and limited coverage of the current systems, no? And it's exacerbated, these limitations are exacerbated further by the low levels of digital and financial literacy among OFWs. Next slide, please. So far, the present programs of the Philippine government agencies for OFWs primarily target accessibility rather than literacy, consistent with the scoping review findings as well as the FGD inputs. So they aim to disseminate information about the benefits in programs. They maintain an open line of communication, and continuously develop digital portals to be able to contact our OFWs worldwide. However, there is divergence among these agencies in communicating healthcare and social protection. One, they are all involved. They all attend in the conduct of PIDS, but not all are present in the delivery of PAOs. They play diverse rather than complementary roles in particular stages of the migration cycle, such that the migrant health unit of DOH is only active during the medical repatriation efforts when migrants return. Pag-ibig funds, loan schemes are available during financial crisis while they are working abroad, and their savings program are attractive only to OFWs during retirement stage. Next slide, please. So in conclusion, we wish to highlight the following points. One, there is a limited body of knowledge, of scholarship on health and social security systems in East Asia, and they reveal the very restrictive character of these systems. As a result, health and social inequities exist in which Filipino migrant workers do not enjoy the same level of health and social protection as citizens of these countries because of the existing multiple systemic barriers. Two, there is no precise conceptualization so far of migrant health and social security systems literacy. So we're offering a conceptualization of that to be studied. And there are a few studies that include Filipino migrant workers, but they problematize access rather than literacy of migrant workers of these systems. Third, in relation to Philippine systems, Filipino migrant workers receive inadequate health and social services owing to the limited coverage and infrastructure. Fourth, Filipino migrant workers' limited knowledge of the Philippine systems is an outcome of the perceived burden of payments and the preferential attitude they have towards systems of receiving countries. And finally, Filipino migrants' basic familiarity to partial understanding of healthcare and social protection programs suggests that they face more barriers than enablers to knowing both home and host country healthcare and social security systems. So for the last slide, I'd like to turn you over to Dr. Montoya for the recommendations.
Sorry, I was on mute. We end by highlighting the following recommendations. Number one, the Philippines has to pursue more bilateral agreements with destination countries toward ensuring portability of healthcare and social welfare of OFWs and complementarity of its health and social safety nets efforts with those of the receiving countries. Two, the Philippine government agency should strive to promote migrant literacy by expanding platforms for disseminating up-to-date information and communicating the programs that respond to specific health and social welfare needs of OFWs according to age, gender, occupation, and visa status across stages of the migration cycle, so from recruitment to retirement. And finally, the Philippine government should establish greater portability mechanisms, reduce barriers, and enhance enabling mechanisms to literacy. In relation to this, our research team like what Dr. Celero mentioned earlier, is currently conducting an action research that advances migrant literacy through a collaboration between migrant groups, migrant NGOs, and government agencies in destination countries to promote health and social security programs for OFW. So that ends our presentation. Thank you all very much. Maraming salamat po.
Thank you very much, Dr. Celero and Dr. Montoya. for that comprehensive presentation. So if you have questions for our presenters, please, I already saw some questions directed to both of you, and you can answer them during the open forum. But at this point, let us listen to the comments and reactions of our discussants from the government and civil society. So our first discussant is Director Jocelyn Hapal of the Policy and Program Development Office of the Overseas Workers Welfare Administration, or OWA. Her office is responsible for policy and program formulation and review under the directives of the OWA Board of Trustees and OWA Administrator Arnaldo Ignacio. Director Hapal has been in government service for more than 30 years. She previously headed the Repatriation Division and the Overseas and Regional Operations Coordinating Services. She also served as welfare officer and attaché at the Philippine Embassy in Athens, Greece, and the Philippine Consulate General in Milan, Italy. Director Hapal obtained her master's degree in Industrial Relations from the University of the Philippines, Diliman, to the Civil Service Local Scholarship Program. Director Hapal, Ma'am Jo, the floor is now yours.
Thank you, Ms. Sheila, for that gracious introduction. To everyone, magandang hapon po sa inyo lahat. At the onset, let me thank the PIDS led by Dr. Aniceto Orbeta for this endeavor, as in the other years, especially during the pandemic years. So it is my pleasure to be a discussant and to give our some reactions and comments from the two studies. So let me start with the COVID-19 support mechanism of the Philippine government. So as today is the Migrant Workers' Day, let me say that the Philippine government continues to guarantee social protection and social justice for migrants, especially during the crisis. This is described back in the law of Migrant Workers Act, where the OWA is tasked to meet in coordination with the Department of Foreign Affairs, of course, in emergency repatriation in all forms of wars, calamities, and other disciplines. So OWA has been for decades, and nakasama na namin mga OFWs sa panahon ng crisis. But nothing quite prepared us for this big one, the pandemic. The pandemic only shows us that all nations in society are intact, regardless of social, economic, and geopolitical state. They are all extremely susceptible to disasters and crises. And this impacts on the OFWs because as of now, we have one of the largest diaspora. We are 10 million strong OFWs in 100 countries, more than 100 countries, such that when the pandemic strikes, marami po talaga ang apektuhan. But during the pandemic, as we operate, our mission was very clear: to bring every OFW safe and free of COVID back to their families and communities. So having this in mind, we participated a very comprehensive and I think intricate operations, of course, under the auspices and leadership of the interagency task force. As we speak, there are more than 1,030,000 Filipino OFWs returns who have been given our signature of care in terms of mass repatriation, food, medical attention, quarantine hotels, transport via land care policy.
Director Jo,
yes?
Director Jo, with all due respect, ma'am, is it possible? Yeah, thank you very much. It's possible to, yeah, the audio is quite weak, ma'am.
Alright, thank you.
Thank you po.
All right, so as we speak, we spent more than 28 billion now, but we are quite proud that the OWA issued to us a qualified fund. Hello, am I okay now?
Yeah, it's a bit better now, but still the audio is still weak. Perhaps something can be done to improve it.
All right. Okay, but yeah, we tested earlier, but then can I proceed even with while our staff is
Sige po ma'am, medyo okay na naman po.
okay na.
Oo,
Okay.
sige.
So as I was saying, we are now 28 billion, and we are proud that the COA issued a qualified opinion in our financial performance. Just to tell you that we are doing our best with the resources entrusted to us. And as we speak as well, tuloy pa rin po ang pag-uwi ng mga OFWs, and of course not as many as before, but meron pa rin po tayo na ina-assistance when some OFWs who were not vaccinated, who are having COVID variant affliction, na-assistance pa rin po natin. So in behalf of the OWA, my administrator Arnaldo Ignacio, and then Administrator Hans Leo Kakda, who was the undersecretary, was being very at the top of these operations. And my colleagues, lahat po ng mga taga-OWA po ay nakikinig kayo. We are extremely grateful for this study. And kudos to PIDS. The comprehensiveness, completeness, and veracity of this study capture the essence actually of the nation's spirit in times of a great crisis. So while the study is about the Philippine government support mechanism, but the true strength relied on the Filipino steadfastness. Alam niyo po, hindi naman po talaga successful para sa amin ang support mechanism, if not for the love and cooperation po and understanding of our OFW returnees. So, if I may say, trademark po talaga yan ng every Filipino resiliencies. We congratulate PIDS for giving a physical print that the next generation can refer to. What naman po sana it was similar situation happen in the future. We take on the mentioned challenges, the lessons learned, and recommendations very well noted po. I encourage our people to read the full text of the study. Maganda po talaga. And sabi nga po ni Yusek, steering ay po siya nila sa pulinan po ngayon, because we remembered how our people put their lives at the forefront during the pandemic. So, but then I have to maybe stress some points, some important learnings which have been mentioned in the study, but just like to emphasize. One, we must remember that OFWs were rendered more vulnerable during the pandemic, specifically on the incidence of deaths related to COVID is really staggering in comparison to what we have seen in the last decades. There have been reported deaths that not only because of restriction, but of course of cultural practices in most countries, particularly in the Middle East, who were not given repatriation, appropriate last respects based on our own culture and belief. So, sana makita rin sa study of how diplomatic and legal intervention with ASA, for instance, that we're able to pass the repatriation rules of more than 300 OFWs in one series of mass repatriation. There were also different sets of protocols that were established, not only in the host countries, but also in the provinces and the regions, especially in the LDUs, in accepting and handling remains. I'd also like to emphasize the base of features on board each and going vessels. We were stranded for more than 3 months at sea, suffering from isolation, from hunger and illness. Unlike most seafarers kasi, whose contracted insurance are protected by the Maritime Seafaring Regulation, the fishers are almost always left to their own devices. And even so, with unpaid salaries for the whole duration of their contracts. So for us in the migration programs, we fill in the gaps, the present rules and regulation for the protection of fishers. Siguro one last is about the cases of women and members of the LGBTQ who were more vulnerable, especially for those with mental and physical conditions, those who were victims of isolation, maltreatment, and abuses during the pandemic. Yes, of course, there are existing support mechanism, but this must be revisited with deep gender lenses. And so is the case of the modern child with special needs and those who have been painful separation because of those countries' regulations involving mixed marriages, adoption, and stateless children. So lastly, I only have a wish for the study. Actually, the study pleaded in some policy questions. One, I think, is that and what is the full responsibility liability of the employers and principals, or even the host government? And in case of the Philippines, SRA and PRA, there was foreign recruitment agency and the Philippine recruitment agencies in times of crisis. So I'm asking about how we share the burden in times of crisis. After all, the contribution of our foreign national, our Filipino expats abroad is so huge that they contribute much to the economies of the receiving countries. So, and also moving forward to redeployment, with this liability translated even before deployment, also in terms of health insurance and medical coverage, and therefore its impact on employment. As we speak now, bumabalik na ang deployment po sa atin, but this time with more competition with other sending countries, it tends to have a bearing on the cost of deployment and on the terms and conditions of work. Okay. And also not only in the terms of repatriation, how can the host country employers and principals to ensure that the stigma and discrimination will not happen? And in terms of ensuring that claims for social benefits and social security are effective even after repatriation. And maybe lastly, as a policy question, what and how will be the responsibility of the host government to ensure that fair and ethical attention and support will be given to migrants in the same manner with their own nationals? So, with those policy questions, I'd like to recommend that sana meron part 3 ang study nito. And all, as part then ng recommendation is maybe the next will be investigating the effects of, if not the impact of the pandemic and support mechanisms on the lives of the OFW returnees. So ano pa po kaya nangyari sa kanila? So with that, maraming pong salamat sa inyo. We assure you that OWA continues its mandate as we speak, where we are, we are attending to the Russian Ukraine problem, we are attending to Sudan conflict right now, and even the issues of the way. Always in the name and interest of the OFWs. Maraming salamat po sa inyo lahat.
And thank you very much, Director Jocelyn Hapal of the OWA. Thank you, ma'am, for your insights and for your reactions to the studies. And yeah, very important policy questions that you have flagged to us that are really worth looking into. Ma'am, if you can get a copy po of your, a printed copy of your comments, so we can share it with our audience, no? We can upload it on our website just in case, because there are certain parts that are somewhat unclear, because of the audio technical issues. So we'd really appreciate, ma'am, a printed copy of your comments. We will hear more from Director Jo during the open forum. So if you have questions for her, do send them using our Q&A box. At this point, let's listen to the reactions and insights of Executive Director Ellene Sana of the Center for Migrant Advocacy, or CMA, an independent non-government organization that works for the rights and welfare of Filipino migrant workers and their families through policy advocacy. ED Sana serves as CMA's principal resource person and trainer in migration-related training forums, programs, and activities here and abroad. ED Sana, ma'am, you may proceed.
Thank you, Ms. Siar. I will share my screen. Magandang hapon po sa ating lahat at happy Migrants Day. Hindi ko masyadong narinig ang intervention mo, Director Joe, but hopefully I look forward to the written copy of your interventions, no? So yun pong paksa ay napakabigat, lalo na sa isang hindi naman academic. But I will try to respond and put in some comments on the studies, the two studies of the PIDS authored by our women. They're all women. Sila Dr. Tabuga, Miss Vargas, and Miss Banyo for the first study. And for the second study, Dr. Celero, very young, but very doctor already, Dr. K. Montoya and Dr. Garabiles, no? Salamat po sa inyong inisyatiba na magkaroon tayo ng mga evidence-based researches. So yung una po, I think it's in order as we talk about COVID na magpasalamat sa ating gobyerno, sa ating frontliners, magbigay ng papugay doon sa mga pumanaw in the line of duty. So maraming salamat po sa buong bureaucracia ng gobyerno. Sabi nga ni Dr. Tabuga, what do you really mean by whole of nation approach? And I think this response to the COVID-19 pandemic exemplified what a whole of nation approach is all about. We usually would use the term whole of government and whole of society, but I think let's adapt. I will adapt the whole of nation in terms of responding to the COVID-19. So big thank you to our government, but also to the international community, to the private sector, relevant stakeholders, and of course our migrant communities as well around the country and also on site. So ang mahalaga po dito ay we are able to deliver at maraming resources ang ginastos, personnel na na-mobilize, especially at the height of the pandemic. And I think at the very least, we have to say thank you to them. Thank you to our frontliners. So in terms of siguro comments on the first study by Dr. Tabuga and party, siguro ilang mga comments. For example, on the issue of ayuda. Of course, for the OFWs, is really the DOLE AKAP. Ang aming komentaryo dito ay yung communicating, in terms of communicating the ayuda to the target beneficiaries who were the OFWs. It created a lot of confusion because the announcement was made March 25 in the media, pero yung implementing guidelines were only issued on April 8. Tapos maraming questions on the criteria, on the process, at paano yun gagawin. And so we had to raise these issues formally as well to our DOLE secretary. But of course, April 18, they already expanded the coverage, and June 23, they issued a supplemental set of guidelines for the expanded coverage. Why am I talking about the timeline of the DOLE AKAP? Kasi nga po ito ay nagkaroon ng mga confusion, miscommunication, and of course, yung expectations ng ating mga OFWs that at the very least, while they are experiencing this impact of COVID, meron silang $200 that they can look forward to. Pero unfortunately, this was announced in March 2020. But then by September, October, and November, we had to step in to assist those who have filed their requests or claims kasi walang action 5 or 6 months later after their application. So yun yung ilang mga concerns dito sa DOLE AKAP. Pangalawa, in terms of ayuda, I don't know if people around in the room were aware that there is also this $200 assistance given to OFWs on site who contracted COVID-19. So again, marami ring naka-avail based on the report of the DOLE to the COA, to Congress. But then, unfortunately, we did not know anything about it until it was reported to Congress. So maganda, we had cases of OFWs who came back home. They contracted the COVID on site, then they came back home. And of course, they were ineligible already for the additional $200 that was intended for those who contracted but on site. Hindi kasi nila alam na meron palang ganun pang dagdag na programa. The other program that could have served its purpose well, especially in very tight situation, emergency situation, yung SSS unemployment benefit. This is part and parcel of the amended law on the SSS. But I think, again, the whole point is the migrants and probably all the other members of the SSS were not so aware. Not that it is something that is secret to the SSS, but the whole point is you have to put it right to the attention of the members of the SSS para maintindihan nila na, uy, meron pa palang pwedeng makuha. So we had to assist, we borrowed the slides of the SSS on this, paano yung availment, paano ka magkukwalify, etc. And we posted it on our Facebook para mas marami yung reach, no? The other thing is food packs to OFWs and their families. Not all posts, and specifically the polos, were proactive in accommodating requests for assistance from OFWs. Very good that the polos, I think all the polos would have their Facebook account for easier communication, accessibility for the OFWs. But unfortunately, the feedback of the migrants who would leave messages in the Facebook ay ilang araw na, ilang linggo na, wala pa pong sagot. Eh, ang hinihingi nila ay food packs, nagugutom sila, they couldn't go out kasi quarantine and all that. Of course, the quarantine would apply also to our people at the post. But again, the point is between the migrant and the polo people who would probably have vehicles, baka pwede silang mag-secure ng arrangements with the host government, mas meron silang capacity and resources to respond to the crisis situation. That we had, at the end of the day, we had to make some interventions on behalf of these OFWs who made the request. So as early as February, we were in communication with groups of OFWs who were affected that early as February, yung mga taga Macau, na no work, no pay na kaagad, no? So, kailangan nila ng ayuda sa ating polo and fortunately, mabilis naman na tumugon. But again, the point is, kailangan may sundot ng CSO. So, sana, paano yung iba na hindi natin nasusundot, no? And of course, that goes the same for the families left behind. So, ito talagang narrative ito ng ating mga OFW families na bakit kami hindi nabibigyan ng ayuda, nilalaktawan yung aming bahay. And again, the contention, they would be hearing the argument that, oh, you're better off than your neighbor kasi meron kang OFW yung nagpapadala ng remittance. So again, the whole point of this crisis is dapat inclusive ang response. Hindi yung, hindi ka kasali kasi meron ka namang OFW. So yun yung mga issues. Repatriation, coming home empty-handed. Of course, I would also like to say at the outset that this whole issue of repatriating Filipinos abroad, even prior to the pandemic, meron ng policy ang Department of Foreign Affairs. Hindi ka may stranded, hindi ka madidistress overseas just because wala kang pamasahe pauwi. May ganung commitment ang DFA. Bibigyan ka ng pamasahe. And compared to other countries of origin, na even at the height of the pandemic, they were still discussing whether their governments would shell out money for the repatriation of their distressed migrant workers. That is not the case for our OFWs. Although nabanggit ni Dr. Tabuga that one factor that caused the delay of the repatriation is who would cover the repatriation. But I think yun nga, if we recall the pronouncements, for example, of the DFA as far back yung bago pa nag-pandemic, hindi ka mamumroblema kung ang issue mo lang ay ang pamasahe mo. So, but of course, related to delays in repatriation would be these issues. Wage theft cases. So what do we mean by wage theft? Unpaid salaries, reduced salaries, delayed salaries, and yun ding denial ng benefits and other monetary benefits and of service benefits. So again, this was borrowed from the IOM study of 2020 na yung umuwi na 67% because of COVID, that translates to 5,000 plus OFWs, yung mga 19%, that's more than 1,000, ay pre-terminated. So they were not ready for that to come back home. 59% did not get their separation or compensation. That's equivalent to almost 5,000 OFWs. More women were affected than male migrant workers. And 17% did not get their final wages, which is about 1,416 OFWs. In our file in CMA, just on the issue of wage theft, as of August 2022, we documented, and when we say documented, ito yung that can withstand scrutiny in court, ha? Kasi meron kaming kampanya on justice for wage theft cases during the pandemic, 206 individual cases, 15 group cases. Ang profile nila, 60% were repatriated OFWs, whereas 40% were on-site cases. So the delays in repatriation resulted to saved earnings being depleted. We had cases of more than 50, 60 workers employed by one company. Tapos na yung kontrata nila in 2019. Last quarter of 2019, inabot sila ng pandemic. So they had to stay in Qatar. For example, this one particular company was in Qatar. Ang nakauwi na lang sila mga September, October of 2020. So during that time, they were not earning anymore. Nandun lang sila sa accommodation waiting for their unpaid wages and other benefits. Tapos in the course of their waiting there, naggagastos din sila. So, binayaran naman sila, yung iba nag-iintay pa, pero dahil naghihintay ka, naggagastos ka, nauubos yung pera hanggang wala ka ng pera. Umuwi ka, wala ka pa ring pera. So yun yung mga sitwasyon. Marami siyang kaugnayan na mga issues, no? Of course, on the issue of access to justice. Justice delayed is justice denied for those who had to return home at hindi na mahintay, kung sila'y umuwi na, hindi na mahintay na magbabayad yung kanilang mga employer. Tapos namang nakauwi na, they may have their recruitment agencies here, pero dahil sa lockdowns, maraming delays sa proseso sa NNRC, sa mga hearing, and then they probably have to go home to their provinces. So again, the whole point is hindi mo ma-process. So we will be always assured by our government agencies, DFA, na hindi maapektuhan ng operations, pero hindi yun totoo. It was easier said than done, no? So yun din yung stigma that goes na hindi ko makita. The stigma, issue of migrant health and the stigma. This is not the first time we encountered a health pandemic or a public health emergency situation. May SARS before, may MERS-CoV. At in those situations, laging nagkakaroon ng tatak yung mga migrants kasi sila yung mobile population na kayo yung carrier ng virus. So whatever happened to all these accolades that you are the heroes, you are the modern day heroes, then suddenly nung umuwi sila ng Disyembre, walang sumasalubong na sa kanila because they are still perceived as the carriers of the virus. So maganda talaga ay we use these occasions na wag ganun ang maging attitude natin dito sa ating mga bayani at dahil marami ang sakripisyo na ginagawa nila. As you would recall when Dr. Tabuga asked us, what do you recall when you hear the word migrant workers? It's about sacrifices, it's about remittances. So sana makatulong tayo na tanggalin yung stigma na nakakabit sa kanila every time that there is a pandemic, health-related pandemic that will break out anywhere, no? Tapos, definitely mental health cases were on the rise. We have always prided ourselves na tayo ay resilient people. Palatawa tayo, we laugh at our problems. And then suddenly, very disturbing, even prior to the pandemic, we started to hear all of these young people killing themselves, even videotaping how they would do it, jumping from the building. But this is not an isolated case for those who are within the country. We have instances and cases of our migrant workers also having nervous breakdowns and of course also committing suicides. And this is an alarming issue. Red flag po ito. Nabasa ko yung comment kanina ni Dr. Ramirez na yun nga, nung panahon ng pandemic when we were having all these webinars, nakilala natin yung National Center for Mental Health. I think mahalaga na matuloy-tuloy natin, masustain natin yung engagement with those offices because our observation was that OWA and the other offices related to migration were not fully prepared to address these concerns, which of course persisted post-pandemic. Yun bang health-seeking behavior ng OFWs nag-improve, learning from the pandemic? Paano? Kasi mamapatay ka na. So, but what do OFW remember? The time of the pandemic 2020, mga bandang Abril, nagagalit ang ating mga OFWs habang sila ay nagwo-worry. Hindi nila alam what this COVID-19 is all about. Unfolding pa kasi eh. Pero kanilang memory, nainis sila sa PhilHealth. Parang wala daw puso yung PhilHealth kasi ang kanila lamang preoccupation ay makakolekta. of course, President Duterte intervened and suspended the collection, ano? So yon mahalaga yon na issue. Migrants' death, so many died. Of course, that has always been an issue. Bakit ka mamamatay? Eh, ikaw ay bata pa. Bago ka mag-abroad, ikaw ay may clean bill of health. Pero sa panahon ng pandemic, namatay ka talaga pwedeng sa COVID, no? So yung issue dito, maraming issue, pumuputok yung issue na yung deceased OFWs, like particularly in Saudi Arabia, were buried without the consent of their families dito sa Pilipinas. What was the truth to this? We have one case at least. We were in touch with the daughter of the migrant worker who died overseas. At wala talagang malinaw na dahilan bakit bakit inilibing yung kanyang nanay. When we checked out the documents, there was somebody there who authorized the burying of the body. At ang nakalagay doon ay son. Wala naman siyang son. So, masalimuot ito. And I think, of course, yung burying the dead or having a family member na namatay ng malayo sa iyo is something very, very, ano yun? Sensitive. So, dapat ito ay mabigyan natin ng paliwanag na maayos. Kasi may namamatay din naman in the past. Pero walang ganitong issue na, bakit mo nilibing yan ng walang consent ng pamilya? May form ang DFA. You will check. Of course, the issue of, kasi namatay siya sa COVID. Meron ding namatay sa COVID na naiuwi eh. So bakit bigla meron kang exception na, itong panahon na to, yun ang dahilan. So hindi consistent. And I think the families of the bereaved families deserve an explanation. Equally important are the death benefits. Medyo marami-rami din in a way, especially because our migrant workers, the majority of them are low-wage workers. Maililiit lang ang sweldo nila. So namatayan ka na nga, at the very least, they should be able to get what is due them in terms of yung death benefits. So meron kang mandatory insurance na mga 10,000, 15,000 US dollars, yung 100 or 200,000 pesos from OWA. Kung member ka pa ng SSS, meron kang death benefit. Kung ikaw ay seafarer, mas marami kang death benefits, etc. Dapat ay masigurado natin na yung heirs nila ay nakukuha to. May mga instances na magsasabi, magagalit yung ating mga taga-DFA kasi sasabihin ng pamilya, bakit mo pa binawasan yung ESB? So yung mga ganon, may explanation naman pala, but I think you have to take the effort to explain na, in the case po na wala kayong anak, namatay po yung asawa nyo, buhay pa yung magulang ng inyong asawa, meron po silang share doon sa death benefits. So yung mga ganon, but you have to make the effort to explain this ng maliliit na bagay, yung maliliit at simpleng paliwanag para maintindihan, considering the context that they are in. Namatayan eh. So I think yun ay mahalaga rin. Okay, key takeaways. Ano ba tong must be, hindi ko makita to. Ba't kasi must be, hindi ko makita yung inclusive, rights-based, and gender responsive. So I think, siguro sususugan ko lang yung sinabi ni Dr. Tabuga kanina, effective and timely communication and coordination between and amongst government agencies and relevant stakeholders. Horizontal yan at saka vertical, hierarchical at saka horizontal, para maiwasan ang miscommunication, confusion, and eventually, ang pinakang magiging epekto nito ay nadidelay yung delivery ng services to our OFWs and their families. Build on the database of Oasis. So parang, finally, meron ka ng datos ng mga bumabalik. Sana ay, as the research said, ay build on that para ituloy-tuloy yung pagkokolekta ng reliable and verifiable data on our OFWs, especially in regard to reintegration, for example. Tapos ito madalas namin itong na-encounter when the LGUs would ask, for example, OWA, ilan po kaya yung uuwi sa amin sa Laguna? Ay laging nai-invoke, naririnig namin yung, hindi kami pwedeng mag-disclose because of data privacy law. So baka lang kailangan mag-level of ano ba yung pwede mong i-disclose kung numbers lang yan at saka dates ng kung kailan sila uuwi. Siguro hindi naman yung violation ng data privacy law. So I think nagiging issue to between the national and the LGU communications. The other recommendation, this is a recommendation dahil so much of our resources was given by Congress, for example, from our national coffers. Maganda rin siyempre na makapag-ulat. Magkano yung ginastos? Magkano yung ibinigay sa dole akap? Magkano talaga yung naibigay, natanggap ng mga OFWs? And that goes the same for the repatriation fund na nasa kalinga ng OWA. And as recommended by the research, for 2023, binigyan po ang ating OWA for the emergency repatriation fund, hindi po yung OWA mismo na pondo, ng almost 12 billion for purposes of the emergency repatriation fund. Of course, definitely, we also have to include in the audit the DFA, ATN funds during the pandemic kasi malaki ang papel ng DFA bago pa ito na ipasa yung ating Department of Migrant Workers. And that said, syempre po yung DMW should make itself felt and fast-track its transition period to take the reins of leadership where OFWs and families are concerned. Of particular importance and interest is the implementation of what this full cycle reintegration is all about. No? So yun po yung nakasulat doon sa on some comments and inputs on and observations on the study number 1. So ito po mabilis lang at ako'y baka tapos ng oras ko.
Oo.
We had our share.
Ellen, if you could fast track that part and
Okay.
then proceed to the second study.
Okay. So i-ano ko lang yan, i-click ko na lang yan. So kami naman po ay busy rin nung panahon ng pandemic. So yan po ang ating mga For study number 2, ito pa mapupunan niyo yung aking ako po sundagot ko na lang yung questions nila Dr. Celero. So una po ay hindi ko naman talaga maintindihan sa unang basa yung literacy. Kaya kailangan ko uli siyang basahin. So I tried to respond to the research questions na pinost ni Dr. Celero. So what do you know about the health security systems in receiving? What the OFWs are most familiar with is OWA and some of its programs. And I said some, hindi yung lahat. I think if the technical side of the concepts are concerned, not much are known to the OFWs. But they are aware that they must have medical and health insurance. Alam niyo po yun, lalo na kung mandatory, even for us local workers, pagka mandatory yung SSS, kinakaltas yan eh. So parang, alam namin may kinakaltas sa amin na SSS, pag-ibig at PhilHealth. But do we know exactly what these programs provide to us? Hindi po until you become aware of it and conscious of it kung kailangan mo na siya. Meron kaming staff na nanganak siya. So hindi niya alam na pwede pala siyang mag-claim sa SSS. Mabuti lang nakahabol na ilang taon na yung anak niya. Saka lang siya naka-avail naman siya dun sa kanyang maternity benefits sa SSS. But I think that is not separate from the attitude of many OFWs. Alam namin yun kasi kinakaltasan kami. O alam namin yun kasi requirement. I think the mandatory nature of contributions to Social Security as well as health security system make this known to the migrants. But yun nga, very, very shallow yung knowledge nila since these are requirements by countries of destination and even in the Philippines. And sometimes nagiging prerequisite ito informally sa issuance ng OEC. As such, these are seen more, I think, as bayarin. Ay nako, gastos yan. But then sometimes they think they have no choice kasi nga ay kailangan nilang sabi ng batas eh. So this is especially the case with the universal health care's mandatory contribution which increases every year. However, for those who are about to retire, they start to rethink of long-term benefits but still not sure how and where they can avail of this. There seems also a high level of mistrust of SSS and PhilHealth among OFWs. On the second question, to what extent do sending and receiving countries ensure that migrants are informed? I am not sure. That is my answer. So I think if ISSS has offices in these places, maybe there are efforts to inform. Otherwise, simple references to the websites does not really help that much. Case study, compulsory insurance coverage, which was in the amended law RA 10022 of 2010. Every time pong may training kami and we will ask the migrants and we will ask the migrant organizations, do you know about this? And the answer is no. All the time and every time. And this is an important coverage kasi po pag kayo ay lalo na sa mga low-wage, low-paid workers natin sa Hong Kong, sa Singapore, sa Hong Kong, sa Taiwan, na laging dumadaan sa recruitment agency, sila po ay may compulsory insurance coverage. So magandang alam nila ito na sila ay may coverage ng medical repatriation, evacuation, disability, death, compassionate visit, etc. But unfortunately, hindi talaga yan makabisa. So I think we should make a concerted effort to inform, no? So yung mga social security, yung social security, hindi pa maintindihan pag inunpack mo, dagdagan mo pa ng social security agreement. So this was in February 2017 when finally the Senate ratified our SSA with Japan. So nung pinost namin to sa Facebook ng CMA, maraming nag-share, maraming nag-like. Kasi nga, even for those who will be benefiting from the SSA in Japan, hindi nila alam anong detalye nun, anong ibig sabihin ng portability, totalization, equality of treatment, yung ganon na issue. So, yun yung malaking hamon dito. Currently, we are dealing with this social security agreement with Korea. This was signed in November 2019. You remember that time na bumisita si Presidente Duterte. Hindi pa ito in-implement because it needs concurrence of the Senate. Ay nung nag-meeting kami nung last week, ang tanong ng Foreign Relations Committee ay nakonsultan nyo ba yung mga OFWs? Ay hindi naman pala nakonsulta kasi there was an earlier version of this way back in 2003 and the migrants rejected the Social Security Agreement. They would prefer to have lump sum money refunded to them. So kailangan mo yung ipaliwanag na ay ganito po ang ibig sabihin pag may Social Security Agreement, may totalization ka na in effect. Kailangan mo yung ipaliwanag. Otherwise, ang naisip nila, nag-contribute kami at the very least, yung aming ibinigay, dapat makukuha namin pag uuwi na kami. Yun yung issues ng bawa sa Korea. No? So our Filipinos, anong tanong dito? So yun, sa literacy na. So ang sagot ko, maybe on the scale of 1 to 10 being 10 being the highest, baka 5 in general. And for East Asia, tsaka syempre yung Singapore, ASEAN, ASEAN yun, Southeast Asia yun, di man yun East Asia. Maybe higher since these countries of origin, of destination have existing programs and systems. But again, the whole point, for example, we have a case in Singapore na SPAS siya, SPAS holder, na stroke siya during the COVID times. Nag-incur siya ng hospital bills na more than 1 million pesos. So he was just working in Singapore para bayaran yung kanyang hospital bills. So sabi ko, wala ka bang medical insurance? Di ba lahat dyan sa Singapore kailangan may medical? Kasi otherwise hindi ka makakapasok dyan. Eh hindi po daw covered yung hypertension, etc. etc. We inquired from our partner, is this true? And the answer is no, it's not true. That you can actually charge it from your medical insurance. So in 2 weeks' time, the payment was settled. The employer was ordered to pay. So yung mga ganon. So parang alam nilang nagbabayad, pero pag sinabi, hindi daw po kami pwedeng kasi parang pre-existing condition. Kino-contest pala yun. Pwede pala yun. So yung mga ganun ba? So anyway, so I'm inclined to actually give a lower rate, but for example, access and availment of PhilHealth by OFWs on site and back end is significant. Why did I say significant? For example, yung mga may kidney problems, like for 2011 to 2016, mga $7 million ang na-claim ng ating mga migrant workers. So parang that's significant. So like in a year, you have like 200 claimants and isang disease pa lang yun, ha? Meron pa silang mga hospital confinements and all that. So I think parang katulad din sa atin, pagka kailangan, may pamamaraan. Kasi di ba kailangan mo ng resources nalalaman eventually kung saan at paano. Pero I think on the side, baka merong kumikita, may fixer ng kaunti, kasi nga hindi pa masyadong alam mismo nung mga migrant workers. So key takeaways. Sandali lang, sister. Okay, be proactive in informing and educating our OFWs about the social protection and social security. Explain what these concepts are and why this is part of the basic human rights of migrants and decent work agenda. Include the compulsory insurance coverage in this education information work. Explain the technical terms like portability, quality of treatment, totalization. Ano ba yung mga ito? So, halimbawa, I already mentioned the pending Social Security Agreement with Korea. We welcome the initiative. This is a new initiative. At OWA Region 3 lang ang meron ito. Tama po ba, Director Joe? Hindi ko alam kung teleconsulta or telemedicine ang term, but this is global. This is not only like for Region 3 or this is not at all related to the OFW hospital. No? So ito ay inisyatiba ng OWA Region 3. So sana masustain. We welcome the formation of the PMHN, and the DOH should ensure support to the programs and activities of PMHN because it looks into and monitors the issue of migrant health. And the Department of Migrant Workers should support the efforts of SSS in particular to promote the importance of SSS on the OFWs, especially as we approach the golden year. I don't know if we will be looking forward, like we say, golden year, and like tatalon ka sa tuwa of this overseas employment program next year. Pero yun po, mahalaga po na tumatanda na yung OFWs natin, yung retirement benefits ay napakahalaga po. So with that, ay tapos na po. Marami pong salamat.
And thank you very much, Executive Director Ellene of the Center for Migrant Advocacy. So the beauty of her presentation is she shared with us what she saw on the ground, no? The actual challenges faced by our overseas Filipino workers, the direct feedback that she receives whenever she interacts with them. And that is very important in our conversation this afternoon, as well as in the 2 research studies that we heard. No? So these shared as important input, important points to validate the results, the findings that our researchers have seen in their studies. Okay, at this point, well, thank you very much, Director Hapal and Executive Director Sana. But before we go to the open forum, our authors may have something to say in response to the remarks of our discussant. So may we start with Dr. Aubrey Tabuga, and then I will give the floor to Doctors Celero and Katigbak. Aubrey, please.
Yes, thank you, Dr. Short. Thank you, Director Hapal and Ma'am Ellene. Sana you've provided a lot of useful insights. For Director Hapal, I'm really thankful, for all the support that you've provided to PIDS research in this particular study, because they were really instrumental in terms of knowing the mechanisms. Although I really acknowledge that there are so many nuances to these processes na hindi namin na-capture. I don't think one study that has been done for only a few months could really capture yung kumbaga yung bread and yung how intense all of those things that happened during the COVID-19 pandemic. And it really gives you an understanding that if we have a crisis like this, sobrang dami. Tama nung nasabi po ni Ma'am Ellene, this is a whole of nation approach. And with that, I think I also realized that if lahat gumagalaw, edit kailangan gumalaw lahat. The problem there is yung communication. Sometimes during the pandemic, hindi mo alam kung saan ka makikinig. Kasi you have the FB of these agencies, and you also have, of course, the IATF, the DOH to listen to. And I think yun yung challenge in the future. I think we really need to work on our communication, clear communication. And siguro for OFW, saan ba talaga kami titingin in terms of information? So we need assistance saan? I think DMW has established their system, yung parang command center nila or yung kanilang helpline. I think that should start what we want to see, like one-stop shop really, like kung may anong concern ko, tas may tracking number siya, yung mga ganong tipong medyo high-tech para mas mabilis, and then mas hindi yung kaya na parang ang dami. I know that there are so many information that are needed to be communicated. Kaya lang minsan yung tao nahihilo kung saan, confused talaga siya, like pakikinig ba ako sa kasama kong OFW kasi sabi niya ganito, nakakuha siya, and then kanino ba talaga ako makikinig? So I think that's also an important issue. We take note all of the challenges, the nuances in the challenges that you have provided. I think we can still enrich the study. The study is not yet publish in like our formal publication. For the information of everyone, we have our journals. We also have a research paper or series wherein yun talaga yung parang formal publication. So right now, it's still discussion paper, and we have this chance to really work on it pa. So we agree for the need of maybe part 2, just to really get all the other details. And I've seen a question also of paano ba nadidistribute yung mga ayuda. We also want to know, for instance, the regional distribution, and then dun sa on-site naman na ayuda, saang countries napunta yung iba, and then so that we can learn all of this. There was a mention like merong low uptake at first, siguro dahil may savings pa sila. So I'm now answering some of the questions. Yeah, but it's really important for us to work on this more. Sana may mga ibang researchers pa that will work on this, kasi napaka niya, ang dami niyang nuances that can help really elaborate on the issues. And yeah, so we will also look into the policy questions provided by Director Joe. So we will work to improve our paper and hopefully to get more information, kasi meron pa kaming data i-collect. Thank you very much po, Ma'am Ellene and Director Hapal.
Thank you very much, Doc Ao. And if I may suggest, because the study covered repatriation, I think it's very important that we cover the rest of the processes, like the return and reintegration. So what happened to our repatriated OFWs? That is a very important policy issue to investigate on, because okay, anong nangyari na sa kanila? Were they able to find jobs? Were they able to integrate successfully and back to their home community? So maganda talagang tingnan yan. Okay, so we now go.
Thank you.
Thank you, Al. So we now go to Doc Joe and Doc Vange. Please go ahead.
Thank you so much for the questions and the interventions by Director Hapal and Ma'am Ellene. Thank you, Ma'am. Kita na naman tayo. Maraming salamat. As always, you've been generous in giving comments, and it's very helpful for us young academics to listen to civil society, organizations, and also government agency. So much gratitude to OWA and all the other 5 Philippine government agencies that really extended support in making this our scoping study possible, because we really want the voice also of the government perspectives also to shine through, and not to demonize for the very limited resources and capabilities that government agencies have, especially during the pandemic. But even prior, we acknowledge that these limitations do exist. And in what ways the next, I guess, course of action to pursue moving forward, and how collaborative we can be, we academics, the civil society organizations, and the migrants themselves also should be empowered in the process, rather than treating them as subjects to be examined in terms of their experiences and struggles. So I think we're coming from that perspective, from that framing of our research, and it's very helpful that we let all these voices come together and see in what ways we can develop more concrete policies and programs that will be beneficial to everyone. Yun, di mahirapan yung government natin, civil society also, hindi rin masyadong mag-effort ng kapok-pok. I hope we come to that time, to that point in time, when all of us will be able to reap the benefits of all of these concerted efforts. But for now, I guess I would want to emphasize also Director Hapal's Direct Joe's comment about really maybe also processing the responsibilities of host country governments, because they also have really a share of burden, and I think what we highlighted that in our study, how the bilateral agreements will really be very helpful at this point in making also the host countries accountable in ensuring the healthcare, social well-being of our workers. Hindi yung tatapon during crisis, bahala na kayo dyan to the host country, the home country should be accountable at that point. Pero dapat it's like a cross-border agreement that would really compel destination countries countries also to commit towards ensuring the healthcare and social well-being of workers. And we promise, no, in the second wave of our study that we will bring to the fore those duties, no, that needs to be outlined, no, what these duties are, with or without the bilateral agreement. But I guess we really want to push for that, because I think our country, I think by virtue of the Global Compact for Migration, all these instruments, international regimes, really point to making commitments, no, towards ensuring the welfare of migrant workers, really cross-border, no, borderless in a way. The second point I'd like to emphasize, again, picking up some of the comments from Ma'am Ellen's intervention, we believe that we anticipated, mahirapan siguro talaga mag-conceptualize, mag-intindi yung mga civil society agents or like CMA, what systems literacy actually mean. It's so academic, it's so abstract. And I understand why you have to read it second, twice or even thrice maybe. But I guess it comes from our agenda as researchers that education should be empowering our migrants, and literacy is synonymous, not to education. So by pushing for literacy program across the migration cycle, no, hindi dapat maging powerless or vulnerable ang ating mga migrants, and that commitment should be held both by the home country, Philippines, and destination countries. So across the migration cycle, there's commitment also towards educating migrant workers. So it's not just about their rights, kasi is very collective, but ensuring that they are vigilant, no, when it comes to what programs, policies could be beneficial to them, so that mentality na you will only bother yourself to learn what the services are when you're in need, that needs to be unlearned. Oo, kasi ganun yung tendency ng mga OFWs. No, kapag nangangailangan lang, doon lang mag-aaral. Dapat they need to equip themselves, no, with that. The literacy needs to be holistic. So meron na nga, we acknowledge there are problems with digital and financial literacy. So yung health and social security system literacy is aligned with all those literacy needs of our OFWs. So so this is why we really push for the concept to be more concrete, be more precise. I think not just in scholarly discussions, but also in policy making. Hopefully this will gain ground, because it's a little bit different from health literacy. It's like migrants having knowledge about their health, with knowing what the health and social security systems, policies, and programs are.
Yeah.
So that they are incorporated to these systems. So I think yun yung gusto naming pagdaanan through our research, na maging konkreto siya. Kasi pag konkreto siya bilang diskurso, then madali nang maipaintindi, no, sa civil society, sa fellow academics, no, sa government, na meron talagang ganitong need. And also to maybe reduce and eventually eradicate the need to frame migrants as passive recipients, passive dependents.
Because they have agency, diba?
Yeah, because they do have agency. No, they do have agency. So I think we're getting to that. We're treading that path, and hopefully by the end of the second wave of the project, no, we'll be able to highlight how in order for health and social security systems to be sustainable in the long run, there should be a continuous learning. So while on the part of the government is a continuous updating of information, on the part of the migrant workers, there should be continuous learning of the changes in the systems. So I think that's not gonna stop there.
Very important points mentioned by Dr. Celero. Continuous learning across, whole stage of the whole migration cycle, no? So hindi lang yung pre-departure, nandoon ka na, nag-transit, nandoon ka na sa host country. Syempre, you should also have continuous learning to prepare yourself, no? When you come back and when you reintegrate, so dapat may retooling dyan. So how can you retool? How can you reskill yourself, no? So yung ganon, very important points. Thank you, Doc Cho. Now, let's go to Doc Vash. He may have something to add.
Yes po, I'll be very brief. Again, our thanks to Director Hapal and Ma'am Sana. Yung aking pong brief response is for Ma'am Sana. Yung inyo pong mga sinabi, I think it just validates the need to really question, to understand, to study migrant health and social security systems literacy. Kasi wala siya. Noong una, hindi natin naunawaan, tayong mga nag-aaral na, nasa academe, nasa mga civil society groups, mga NGOs, hindi natin alam. Hindi rin tayo conscious. So, lalo na yung ating mga migrante, lumalabas ng bansa. So, we need to tulungan tayo sa ganitong aspeto ng pag-i-equip sa kanila. At kagaya po ng mga nabanggit ninyo, yung mga nakikita nyo on grounds, talagang kapos na kapos sa kaalaman ng ating mga manggagawa. So pag umalis sila, paglabas nila, para silang sinend dun sa lion's den na wala silang kakayanan na parang quite helpless, although nandyan meron tayong mga policies, meron tayong mga programa, pero since hindi nila alam, nangangapa sila. And yung pangalawa ko pong comment is very minor, no? Na-pick po yung aking geographer identity. Yung ang Singapore po is still part of East Asia, although nasa South lang siya, but of course it's very ASEAN. I think kabahagi din ng geografiya, no, ng mga Eastern Asian societies. Therefore, sinama namin Singapore, although we acknowledge that yeah, it's quite different in the sense that it's in the south and part of the larger ASEAN. Thank you po.
Thank you very much, Doc Vange. So let's go to some of the questions of our participants. Well, I was looking at our Q&A box, and I think all of the questions have been answered. So thank you very much. Now let me read a question from Dr. Francis Kimba, and I think this is directed to our researchers, the researchers of our second study. What level of language proficiency for OFWs is needed to understand the details of health or social security insurance? Should there be a program that would increase language proficiency and understanding of health/social security insurance? Who would like to answer that? Either Doc Jo or Doc Vange, please.
At present, no, based on our studies, which is actually consistent with Ma'am Ellen's observation as well. Ma'am, we understand why it's 5, because your score was 5. Because at the moment, it's OFWs lie along the basic level of literacy. It's because of the mandatory nature of some of the national health insurance, no, in the destination country. We have PhilHealth here, so they know the basics because we incorporated them in the PIDS, no, and to some extent in PAOS, no, it's reiterated. But based on our framework, no, the next level would have to be understanding. So you gain an understanding of health and social services when you're already stable in destination countries. No, that's our theorization. No? Now, the highest level is knowledge. No? So knowledgeability. So it's like an advanced level of literacy where you can navigate both the systems in destination and origin countries. No? Now, the question is, how long would it take for our migrant workers to be able to reach that advanced level? No? I think we haven't completed, no, the analysis, no, because we are very much focused on domestic workers. By the way, no, the limitation of our study is we are focused on domestic workers' experiences in the 3 countries. Okay, so not really intentional to exclude other, you know, migration trends. No, thank you, Ma'am Veronica, for the comments. But we want to be uniform, no, in our observations, no, of the particular population of migrant workers. So at least in Hong Kong and Singapore, I would say, because of the circular nature of their migration, and they're not really have the tendency to become permanent or long term, no, it would be difficult to achieve advanced level of literacy with the kind of, I would correlate, no, the pattern of migration and residence in destination country to the acquisition of higher levels of literacy. Because if there's a lack of access to permanent and long-term status and destination, it would be difficult for them to be most familiar, most comfortable, no, even if systems are ever changing. So the varying levels of literacy and the acquisition of highest level up to a point where they become familiar with the importance of insurance, I think we're very hard to imagine, at least in the case of domestic workers, that they have more temporary nature of labor migration.
Okay. Thank you very much, Doc Joe. Director Joe. Okay, from Doc Joe, I will jump to Director Joe. Director Joe, please go ahead.
Yes, thank you very much. One important point only. Going back to the literacy, information dissemination is very important to increase literacy. And people would always point out the PIDS, the pre-departure orientation seminar. It's really a very potential avenue to provide information to empower workers, But and some people would say it's too little, too late. All right, as the study points out. But then in the same study result with the FGD, it says too much, too late. Okay, so we're always in a quandary about this. Okay, and I think we should give a proper context on this. The PDOS is really for pre-departure, immediately prior to the flight. Okay, so it is about a week before, or some would be a days before the flight. So ito yung mga huling bilin. How to navigate the airport, what documents you should, and don't forget the main provisions of the contract. So yun lang po talaga ang objective niya. Okay, so and then if we introduce the portability of the benefits, if we introduce what kind of visa will be entitled to which healthcare services, oh my goodness, talaga pong hindi talaga kakayanin. Context, so we're now saying to the new Department of Migrant Workers to please tingnan natin into a continue ang buong pre-employment, pre-departure orientation seminars. Okay, na for those that requires deeper understanding and of course the principles of progressive learning. So many of those topics should be well before the about to depart PIDS. Alam niyo po ba, during the Colombo process, when the countries present their best practices, minimum po 3 weeks. Okay, in some countries po 3 months to 6 months.
But here in the Philippines, gaano po katagal?
Ayun po, lahat nagmamadali. 2 araw na nga lang pinapagalitan pa po kami.
Yun na nga eh.
Kaya we really take seriously, I agree with you. Your study successfully points on the need to increase talaga po literacy. Kaya naman po, we're looking again at the policies na gagawin siguro ng department, and we will heavily engage ourselves para po doon na maayos na rin po yung mga PIDS po natin.
And that is why also Director Joe, given also the limited resources, limited capacity of also of the government, we need the support, we need the partnership of NGOs like Center for Migrant Advocacy, who have been supporting, doing their advocacy work. Di po ba,
Yes,
Miss
lagi po
Ellen?
namin kasama si Miss Ellen. Di po siya nawawala ang CMNA.
Kaya nga, ayun nga yung inaano natin na whole of society, whole of
Right.
nation approach, kasi hindi kaya naman lahat ng ating pamahalaan. Okay. Any thoughts, Miss Ellen? We miss your voice here.
No, I definitely agree at nakakatuwa tong ating mga researchers kasi 'di ba part ng GCM kasi you have to be evidence-based in your articulation, but more than that I think to have informed policies. So mahirap maggawa ng policy na walang maayos na data, walang maayos na analysis. So naalala ko lang yung halimbawa yung sinabi ni Dr. Tabuga yung sa repatriation. Magpapadala ka ng eroplano, hindi mo nga alam ilan kaya yung sasakay. to the extent, at ito, may mga namamarites ka na, kung sino na lang gusto sumakay, sumakay na lang. Pero, di ba? So, nasasayang resources pag hindi maayos ang mga datos, hindi maayos yung pagtingin doon sa mga bagay-bagay. So, I think it's important that we have this PIDS na hindi na hindi na nanawang magsulat. Kasi mahalaga yun. Kasi kami naman, hindi kung groundwork practitioners kami So we need people, researchers, academics, to synthesize, tingnan ano bang nangyayari dito. Kasi kami, ang nakikita lang namin yung aming mga mundo na ginagalawan. So I think nakakatulong yon para mag-complement and then come up with responsive programs and services. Siyempre, lagi tayong babalik sa national government, but definitely, lalo na dito sa usapin ng information, we should be tapping
That's right.
and onboarding our LGUs and the migrant organizations as well.
Yeah, that is a very important point. We should yung role ng ating mga LGUs, because at the end of the day, saan ba babalik yung ating mga OFWs? Or saan ba sila nanggaling? Dito sa mga communities, 'di ba? So kung meron nga lang magandang livelihood dito, hindi na nila kailangang umalis. Ang maganda, may maganda rin silang babalikan para makakuha ng hanap buhay, no? So hindi sila mahihirapan pag kahit na ma-repatriate sila forcibly, no? Meron silang babalik ang mga hanap buhay. So magandang tingnan natin talaga yung after the repatriation, yung return and reintegration. Now we have a question here. Okay, and this one is from medyo bigla siyang nawala. I think sinagot na ata. Let me check. Okay. I think it was already answered. Rodora Abano, were the researchers able to interview some OFW help desk or migrant resource center or PESO on their role, capacity, and challenges in helping in repatriation and regarding health and social security, them being the closest structure to FWs and their families, given the fact that most PESO has many other concerns? Doc Aubrey or our researchers, Doc Joe and Doc Vanch, meron ba kayong na-cover ba ito ng study nyo? Please?
Yeah, unfortunately, it's we weren't able to go down to the local levels to talk to the PESO, and I think their roles are really very important also. So these are the nuances na hindi namin na-capture, and I think this can be good candidates for future studies. And I'd really like to reiterate that even with the pandemic ending officially, we should not move on so fast. No, we need to learn from this. So I think we should continue still to do these studies.
Okay.
Yeah, but thank you for that.
Okay. Thank you, Dr. Au. How about our other researchers?
We also failed, ma'am, to capture PESO, but we tried to contact embassies in destination countries, no, but to no avail. I think that because election period at that time, the transitioning to new ambassadors, and consul officers. So I think that also was a constraint during the data gathering phase. But hopefully through the second wave, we will invite destination country, related officers and entities, hopefully, maisama po yan. But thank you for pointing out the importance of LGUs and PESO officers.
Okay. Thank you very much. Wow, what an interesting and engaging discussion we just had. So to cap our conversation, may I ask our speakers for some brief parting words if they have any? Can we start with our presenters, Dr. Tabuga, Dr. Celero, and Dr. Montoya, please? Dr. Au, mauna ka na.
Thank you, Dr. Sheila. Again, thank you for this opportunity for our team to share our study. I'd like to say that, well, even with the pandemic and the horrible experiences of OFWs with this pandemic, many of them still prefer or opt to go back. And so labor migration is here to stay, and we should continue to do this research, work hard to improve our policies and our governance aspects. And also for me as a researcher, this is really one of my my passions in terms of research areas. So yeah, we need to work harder still for labor migration. Thank you.
Thank you, Dr. Tabuga. Please, Doc Cho and Doc Banj.
Yes, thank you very much to PIDS once again for the opportunity to do this research and the second part of this research. Thank you for funding it as well. And we look forward to sharing the insights of the follow-up research towards the end of this year. Hopefully, me and my colleagues will be able to gain productive insights as well and worth sharing to the greater public that would provide serve as evidence for policy making and advocacy as well for the benefit of our NGO partners such as CMA. Thank you so much to Ma'am Ellene, Director Hapal, and looking forward to contacting you again for as our research makes significant strides in the coming months. And our working paper, our discussion paper is available online. We're so happy we're getting hundreds of reads already, and in the process getting comments. Thank you so much to Ma'am Veronica for the comments, very generous comments, and we hope to incorporate them in the publishable form of our study. I think that would be all on my part.
Thank you, PIDS. Thank you, PIDS. Thank you again to Dr. Hapal and Miss Sana. Maraming salamat po sa ganitong oportunidad na talagang hindi lang maihain yung aming mga pag-aaral, kundi makakuha rin ng mga feedback. I think this is a very important exercise for academics to get feedback on what we do, but also not only from co-researchers, co-academics, but from other people involved, lalo na dito sa usapin ng mga OFWs. Very real na concern, everyday concern, napakalaking concern ng ating bayan, pero nakakatuwang sama-sama tayong kumikilos para sa kapakanan ng mga taong bahagi natin sa pagbubuhat ng bayan. Salamat po.
Maraming salamat din, Doc Vanch. And now may we hear from our discussants, Director Joe Hapal of the OWA.
Yes, as a parting message po, can I request that our two e-posters be shown? I'll take this opportunity po kasi, we have 800,000 followers of our OWA FB page. Naka-live stream po kayo sa OWA FB page. Kaya po may pagkakataon po yung mga OFWs natin na marinig po ang inyong presentation ngayon. From Monday to Sunday, pag nag-day off na sila, they will have the opportunity. Just to let you know, because of the precarity of work, because of the trust issue, because of the cultural and language barriers, kaya po naglalagay po kami ng mga pwede pong tawagan in terms ng pagkakasakit, pag may issues on medical, and even mental health. So we have provided, screenshot na lang po, ibigin ko sa mga OFWs, please do call us. Ito ay through Viber and WhatsApp, yun ang pinakamarami po kasing means of communication ng OFWs natin. Please do share this. We are just 1 PM away, 1 call away. At meron po tayong pool of doctors and pool of psychiatrists and psychologists at hand para po sa serbisyong ito. Maraming salamat po. OWA cares. Thank you.
Thank you very much, Director Joe and Miss or Executive Director Ellene Sano of the Center for Migrant Advocacy. Ma'am, go ahead.
Pasalamat po. Pasalamat din. Thank you, PIDS, for this opportunity to join the conversation. At sa ating dalawang team ng researchers ay napapanahon at mahalaga po and urgent yung usapin ng social protection. Si Dr. Tabuga nga lang ang nakita ko nagawa ng research na una kong nakita, and it's very much appreciated, especially as we approach the 50th year of this Overseas Employment Program. And definitely, migrant health ay hindi naman bagong issue, pero I think ngayon lang natin nabibigyan talaga ng pansin sa hindi lang yung physical but then the mental health aspect as well. So ituloy po ninyo ang inyong mga pagsasaliksik. Maraming salamat po.
Thank you very much, Edie Sana. Well, thank you very much to all our guests. Friends, please join me in thanking them through a big virtual clap. And we also appreciate your active participation in the poll and the poll conducted by our speakers and also in the open forum, especially to Dr. Veronica Ramirez of the UANP, University of Asia and the Pacific. Ma'am, salamat po sa mga questions niyo at sa inyong mga comments, which our audience also have seen in our Q&A box. And we also would like to wish you the best of luck in your research, migration research. Marami pong salamat, ma'am. We hope everyone that the findings and recommendations of the studies we featured today and the insights shared by our speakers will help our policymakers and program implementers improve our current policies and support mechanisms for our OFWs in the entire migration life cycle. We must ensure that they have adequate information and protection before they leave the country, while they travel, while they are overseas, that they are safe and secure, especially when unexpected shocks occur, and they lead productive and meaningful lives when they return either temporarily or permanently, and when they reintegrate back to their communities. So we hope that you enjoyed our discussion today and learned a lot as well. And here are the winners of our webinar raffle. Okay, from Facebook, we have Zel DG from the CMA. O baka staff ito ni or kasamahan ni ni Ma'am Ellene. And from Zoom, Antro Soledad from the National Maritime Polytechnic, and Camila Meneses of TESDA. So Zel, Andrew, and Camila, our webinar team will get in touch with you for the delivery of your prize. And finally, we have some reminders. You can access all the presentations from today's webinar on the PIDS website, including the studies of our authors, which are available as PIDS discussion papers. Please answer the feedback survey that will pop on your screen after this webinar. Your comments are important to us to improve our events. And also, please regularly visit our website and follow us on Facebook and Twitter. We also have a YouTube channel where you can access the recordings of our events. Well, we have 2 more webinars coming this month. Okay, on June 15, we have our webinar on exploring the impacts of reviving the open pit mining in the Philippines. And on June 22, we will have the launch or the virtual launch of the PIDS book. This is our newest book entitled Critical Issues in the Philippine Digital Economy. So June 15, June 22, please block these dates in your calendar, and just wait for the registration details, which we will announce on our Facebook page. Okay. And finally, we would like to acknowledge the various organizations from the government, academe, civil society, business, and international development community that join us today. Well, this concludes our virtual policy forum. Again, our sincerest thanks to all our guests and participants on Zoom and Facebook for your active participation. We hope you'll join us again next week. Maraming salamat po at mabuhay ang ating mga OFWs.